I'm going to order this hearing. This is a public hearing of the Committee of the Whole of the Council of the District of Columbia. I'm Phil Mendelson, Chairman of the Committee of the Whole and Chair of the Council. Today is Wednesday, October 27th, 2021. The time is 10:31 in the morning, and this hearing is being conducted virtually. It is being broadcast live on the chairman's website, which is www.chairmanmendelson.com/live. I don't believe it's being broadcast on cable television. There's another hearing at the same time. This hearing will be recorded and is available on the council website, or will be available on the council website, which is www.dccouncil.us. The subject of this morning's hearing is Bill 24-423, entitled The Coronavirus Immunization of School Students and Early Childhood Workers Amendment Act of 2021. This legislation was introduced on October 4th by council members Christina Henderson, Charles Allen, Mary Cheh, Brianne Nadeau, Melissa Silverman, and Janice Lewis George. We're moving fairly quickly on this legislation because members are generally supportive of a vaccine mandate. And and if it's to be of some value, then we probably need to effectuate this fairly quickly. That is recognizing that there may need to be some refinements made to the legislation, and that's in part what this hearing is about. The purpose, I should say a little bit more, the purpose of Bill 24-423 is to require all eligible students of District of Columbia Public Schools, public charter schools, independent schools, private schools, parochial schools to be vaccinated against the COVID-19 virus. The bill is introduced, says, by December 15th, 2021, and every school year thereafter. Additionally, the bill mandates that employees of licensed child development facilities in the District of Columbia are to be vaccinated annually against the COVID-19 virus. The vaccination mandate shall be waived if the individual is exempt on religious or medical grounds. Further, as introduced, the bill would require that beginning December 15th, 2021, the bill directs all private physicians who administer the COVID-19 vaccine to submit an immunization certification to public health authorities, and for those authorities to transmit electronically the immunization certificate to the student's local education agency. Beginning with school year 2022, that's the 2022-2023 school year, the electronic certification requirement shall apply to all immunizations. The record in this matter will close at 5 p.m. on Wednesday, November 10th. That's, I believe, 2 weeks from today. Again, 5 p.m. Wednesday, November 10th, the record closes. This is the first of two hearings the Committee of the Whole is having today. The second is on some appointments. And the Committee of the Whole has other hearings related to public education in schools coming up, but I'm going to forego that. Before I turn to colleagues, I do want to apologize for our starting late. One of the joys of being chairman is that I get phone calls at the last minute. So I apologize that under other business intervened or interfered, I should say. I'm going to turn, I believe this is the order in which members arrived. Janice Lewis George, followed by Christina Henderson, followed by Robert White, followed by Alyssa Silverman. So if you have opening comments, Lewis George.
Thank you. Thank you, Chairman, and thank you to our witnesses for making time to speak with us today. Getting vaccinated is the best way to protect yourself and your family from the virus. That's why I was proud to get the shot with my mom earlier this year. We need everyone to get vaccinated to stop the spread and protect vulnerable members of our community. I'm proud to co-introduce this bill, and I thank Councilmember Henderson for bringing it forward. I agree that we should fold the coronavirus immunization into our regular requirements for attending schools. Kids already have to get shots to attend school, and we've got to adjust to make this part of our normal vaccine regimen. We just have to. This is a step in normalizing the coronavirus vaccine as a part of our school registration process. I remember as a DCPS student getting shots before school, and we can make this a normal part of going back to school. Immunizations have been a part of going to school as long as we know it, from my parents to my grandparents to our generation now. And so this is the time for our generation to see a new shot, a new vaccine added to the list, and to do our part to make our greater community safer. I'm glad this bill goes beyond DCPS to include our charter, independent, and parochial schools as well. When it comes to public health, we've got to do everything we can to protect the community. We can't have one set of rules for some kids and another set of rules for others. Additionally, I'm glad that we're including our childcare sector, which all too often are left out of conversations around this. I was proud to help lead the council's call to add childcare employees to our list of essential workers who needed to be prioritized for the vaccine. I'm also really glad that this bill puts us on a path to allow electronic certification of all immunizations. We know many families struggle to get their shots on time, and the district's no shots, no school policy looms as a barrier to everyone returning to in-person learning when we know they should. So we've got to do everything in our power to facilitate that work. I'm concerned that we still don't have a written plan from the executive about how we'll get our children vaccinated. I've been asking, along with other colleagues, for DC Health to produce a plan for weeks, and they still haven't. Without a written plan, it'll be challenging to hold our leaders accountable to timelines and objectives of efficiently and equitably distributing the vaccine. Further, I'm concerned that we're still relying on the private sector to get our children vaccinated. We know there are long wait times to get appointments at pediatricians, and some families don't even have a regular physician they see. We should be planning now for in-school distributions to ease that burden on our families. Low take-up from our summer school-based sites is irrelevant to this conversation. It's completely different to compare the number of kids who make the trip to a high school over the summer versus their school that they attend every day. So thank you again to Councilmember Henderson for drafting this legislation and her staff. Thank you, Chairman, for holding today's hearing. I'll be in and out today for some Ward 4 matters, but we'll be monitoring what's said. And thank you for your time. Bye-bye.
Thank you, Councilmember Lewis George. Councilmember Henderson.
Thank you, Mr. Chairman. Good morning, and good morning to my colleagues and all the public witnesses who are signed up to testify today. I'm pleased we're holding this hearing. The start of the school year, as we all know, was met with anxiety among many students, parents, and school communities, with concerns about in-person learning and its potential to spread COVID-19. Much of the anxiety was related to vaccinations being unavailable for individuals under the age of 18, leaving some parents wondering about the safety of their children. Since the beginning of the school year, vaccines have received full authorization use for individuals over the age of 16, and the use for 5 to 11-year-olds, we believe, is forthcoming. So why do we need to mandate the vaccine? First and foremost, because we need to protect our community health and reduce the spread. We know that vaccines work. We eradicated the contagious smallpox virus, reduced the instances of polio, and some other dangerous diseases. They're also effective because we already require vaccinations against several diseases, including measles, mumps, and other threats to public health. Additionally, the pandemic has disproportionately affected communities of color, and these numbers are stark. A recent analysis of DC Health data found that 49 of the 50 DC residents who have died since June of COVID-19 were African American. 60% of those residents lived in wards 7 and 8, and the vast majority of those residents who died were also unvaccinated. As we wait for the approval of the FDA to allow children ages 5 to 11 to receive the vaccine, I believe it's important that DC has a school-focused vaccine mandate and facilitate a smooth rollout. This bill would require all eligible school students and employees of licensed child development facilities in DC to be vaccinated as well. We know that for the early learning community, understandably concerned about uncertainties surrounding certain variants, unvaccinated peers, and the scale of a testing program. The vaccine mandate will help advance the goals the mayor's order goals stated in the mayor's order on vaccinations and decrease exposures, the need for quarantine and remote learning, while increasing efficient and effective operations for schools and childcare centers. I know that there are there's lots of discussions that have happened from the FDA's meeting yesterday, and we anticipate what's going to happen with the CDC in a couple of weeks. So I acknowledge that there will likely need to be some changes to the bill in terms of the date, and perhaps we might need to bifurcate the groups of students. But I'm looking forward to the conversation from the public witnesses. And thank you again, Mr. Chairman, for holding this hearing today.
Thank you, Councilmember. Councilmember Robert White.
Thank you, Chairman. I'm glad we're having this hearing, and I particularly want to use this hearing to listen to folks to understand concerns and recommended processes. One of the concerns that I have about the bill is the December 15th requirement date for young people, especially understanding that 5 to 11-year-olds will likely become eligible for the vaccine in November. And this timeline, I think, doesn't give us, both practically enough time to get everybody vaccinated. But I think we also have to remember we do want everyone vaccinated, but there is a great distance between people who want their children vaccinated on day one and people who are anti-vaccination. There's a lot of distance in between there. As a parent of young children, as several of my colleagues are, I know that when we make decisions for ourselves, we make them differently than when we make decisions for other people, like our children. I got my vaccination the first day that I could. As a parent, I am more cautious with my children than I am with myself, and I think many parents are. And so in considering our ultimate goal to get people vaccinated, I think we want to be just thoughtful and not doing anything that creates unnecessary resistance or consternation. So adults, we became eligible February, March, April, and we started requiring vaccinations for many people in August or September. So people had about a half year to kind of, get comfortable with it. For young people, we're not giving anybody any time to get comfortable. Maybe that is the right way to go, but maybe that's going to have the opposite impact of what we hope. So I just want to make sure we're being thoughtful. We're listening to parents. There will be a variety of views. And I think we want to hear those views and not kind of assume that anybody who's hesitant about getting their children vaccinated on day one is somehow anti-vaccination. We also recognize that we require some vaccinations for our children, but not all of them. The flu isn't required. So one of the things I'd like to understand is, where do we make that distinction between what's required and what's not? Because that's a question that we will have to answer for parents. So I come to the hearing to listen. I think it is very clear that we will have to act. I think it is clear that vaccinations for COVID will be and should be required. Now, I guess the question is on what timeline and what feedback we are going to take in developing that timeline. So I look forward to hearing from witnesses. I'll be jumping in and out, so I have questions for some panels, but not all of them. Thank you very much, Chairman.
Thank you, Councilmember White. Councilmember Silverman.
Good morning, Mr. Chairman. Good to see you. Good to see my colleagues, and hello to all the witnesses and those watching. I want to thank you, Mr. Chairman. As you mentioned, this bill has quickly found its way to a hearing. I want to thank you for that. I also want to thank Councilmember Henderson for your quick work and your staff's quick work in drafting this legislation. And I'm here because I am a co-introducer of the legislation. I do want to pause on something you said, though, Mr. Chairman. So you said that there's general agreement among council members about this legislation and the need to implement a vaccine mandate for our schools and early childhood centers. And my colleagues have said it well. I won't repeat it because we're already running behind. The vaccine is the most effective way to limit the spread of COVID-19 and eventually end this pandemic. Yet there is disagreement about a mandate, even among our own colleagues. Here at the council, we had a debate about putting in a mandate for our own workplace. And what I want to stress, Mr. Chairman, and what has become so apparent to me about these past 20 months is we have difficulty talking to each other about where we disagree and have different viewpoints. And it ends up becoming angry and contentious and at a point where we can't persuade. And we can't afford to do that in this city anymore. I'm just going to use this as an example, but people do have different views. I think Councilmember White said it well. There are some people who, I think getting to yes on the vaccine comes at different points for people in our city. Now, some people are definite no, but I think there are a lot of people who might be what I would call slow to yes, or want to see, or are just nervous because this is about their children. And I think we need to be able to talk about that in a civil, respectful way. And I'm just going to point out that we view issues so differently in our city, and the vaccine, depending on what our race is, what our income is, where we live geographically in this city. But we are a city and we need to make these decisions together. So I'll just point out, 3/4 of students who are eligible in Ward 2 are fully vaccinated, but only 1/4 of students that are eligible are fully vaccinated in Ward 7 and 8. We need to be able to talk about that in a way that is constructive. I'm out of time, Mr. Chairman, so I'll just say I look forward to the conversation. And thank you again to Councilmember Henderson for writing the bill, and to you for hosting this hearing.
Thank you, Councilmember Silverman. I'm going to call the witnesses in 2 groups. So the first group will be 12 individuals. The first 12 on the list: Nicole Manchester, Sandra Moscoso, who is on the list as a parent in DCPS, but I know she's also active with, I believe, the Ward 2 Education Council. Heather Scholl, who's listed as PTO president at Eastern High School. Salim Adolfo, who's a commissioner with ANC HC. Shannon Hodge, who's executive director of the DC Charter School Alliance. Shara Greer, who is the policy director at the DC Children's Law Center. Nathaniel Beers, who's executive lead at Children's School Services. Jason Parrish, who's a parent. Nikki D'Angelo, who's with Democrats for Education Reform DC. Kyle Myers, who's also with Democrats for Education Reform. Claire Bogard, who's medical director of the COVID-19 vaccine program at Children's National Hospital. And Gabriel Rojo, who is student services director at Carlos Rosario International Public Charter School. So those folks are being let in.
Chairman, may I do opening statement while folks are joining?
Yes, you may, council member.
Thank you. Really happy to have made it. And thank you so much for convening this hearing today. One of the things that's really important to note at the outset, COVID vaccines are incredibly effective, including against the Delta variant. Multiple studies have shown that fully vaccinated individuals are highly protected against severe infection, hospitalization, and death caused by the virus. Our Department of Health has released its initial set of data on breakthrough cases and announced that just 6% of cases and 5% of hospitalizations since January were among vaccinated residents. Now that the CDC has authorized vaccines for individuals aged 12 and over, it's imperative that we ensure more of our community is fully vaccinated now. It's also imperative that all employees of licensed child development facilities are vaccinated to greatly reduce the risk of spread to young children they care for on a daily basis. As a parent of 2 children, I can attest personally to one aspect of this bill that I think is critically important, the poor process for submitting immunization certificates. And I hope that we'll learn from this and be able to expand it beyond COVID, but electronic submission to LEAs so that they know the kids are vaccinated and parents don't have to go chasing after paperwork and get it into school is really going to help us understand our vaccination rates and make parents' lives easier. I look forward to hearing testimony today. I support the vaccine mandate. I support this legislation. And I look forward to the dialogue. I think we're going to get into some really important issues here. But at the end of the day, I think the thing that can keep us focused on the science and the facts is we know that the science behind these vaccines is tried and true. We now have millions of people who've had them. The science has been around a long time. The wild card here is the coronavirus, because we just don't know how it'll impact any person until they have it. And for me, with 2 small kids, my fear every day is that one of them will get it and will get terribly sick. I don't want that for any child or any parent. And I look forward to a time when we can have all of our children vaccinated. Thank you, Mr. Chairman.
Thank you, Councilmember. And before I turn to witnesses, if any councilmember wants their statement included in the committee report, please submit your statement to the committee of the whole staff, and we will include them. So we'll begin with Nicole Manchester. The witnesses will be on a 3-minute clock. I'll be a little generous in terms of not cutting folks off right at three minutes. If you're in gallery view, you'll see the clock, I believe, in the top row of your screen. Ms. Manchester?
I don't think she's here, Chairman.
That's always a good way to start a hearing. All right, well then we'll go to Sandra Moscoso.
Hi, good morning, Chairman and Council members.
Morning.
I'm Sandra Moscoso, Vice President of the Ward 2 Education Council and Secretary of the Ward 6 Public Schools Parent Organization. Today, I am providing testimony on behalf of both organizations in support of Bill 24-423. We ask that you exercise powers within the legislative to mandate vaccines for eligible students enrolled in DC schools. In this testimony, I will pull from letters recently submitted to Mayor Bowser and Chairman Mendelson on behalf of high school PTOs in Wards 2 and 6. The 2 schools mentioned represent 1,335 families. Like all school communities, we want our school district to provide the safest possible environment in which students learn and educators work. In Ward 2, the School Without Walls High School HSA polled families to determine how the HSA could provide support to increase vaccination rates. The overwhelming ask was for the HSA to advocate for a vaccine mandate. The Ward 2 Ed Council has reached out to member school leaders indicating our plans to support a student vaccine mandate and have received no objection. In Ward 6, at a recent Eastern High School PTO meeting, without objection, the PTO received support for advocating for a COVID-19 vaccine mandate. At our October Ward 6 Public Schools Parent Organization meeting, representatives from member schools also agreed on support for such a mandate. Our organizations appreciate and support the efforts undertaken by DC government to encourage families to vaccinate. We support the mandate for staff vaccination and for vaccination of eligible student athletes. However, we worry that the pace of vaccinations for eligible ages will not be sufficient to slow down the current wave driven by the Delta variant or future variants. The existing mandates also don't address indoor clubs such as theater or choir, and that makes no sense. We have heard the medical community, mayor, DME, chancellor, principals, and community leaders say that COVID-19 vaccines are safe, effective, and vaccinating is the strongest way to protect our school community. We support this and in turn, hope the DC government will join the state of California in serving as a leader in keeping schools safe and open for in-person learning by immediately implementing a mandate, and legislation is necessary. That all students who are eligible for vaccine be required to be fully vaccinated against COVID-19 as soon as possible. It has been a difficult year and a half. You have no doubt seen more advocacy from families than ever before, in particular around school safety and school resources. We're all exhausted and can't fathom another petition or large-scale communications to your offices when we are all in support of everything our city has been messaging around vaccines. Please support the strongest tool we have toward ushering our schools and our city out of the pandemic. Mandate vaccines for eligible students. Finally, and it should go without mention, that leadership entails both setting firm lines in the sand and supporting students and families to get across the finish line toward vaccine compliance. So please, help us with that. Thank you for holding this hearing, and thank you for listening.
Thank you, Ms. Moscoso. Heather Scholl.
Good morning. I need you to think of a really horrible, hectic day that you had when you needed to be in multiple places at the same time, when you didn't get to finish your morning coffee and lunch's chips at 4 p.m. Now play that out as your everyday. This is where school staff is right now, not only at Eastern, but at all schools. In normal times, each school support staff member is doing the job of 2 people, just because that's how the budget goes and they make it work. But now, because of COVID-related absences, the days are almost unbearable. Instead of doing her regular duties, the director of strategy and logistics at Eastern is frantically calling and texting teachers to see who can cover for this class or that class when teachers call out. That means teachers who are in the building aren't getting planning periods. Daily tasks are put on the back burner. The system is collapsing because everything in the day is reactive. The AC was out in most of our schools, so they had to react by trying to move classes to a cooler room. The effect of every person out for the day cascades. It's one fewer for lunch duty, for covering the phones, for ordering supplies, for helping students, and for all the little things that make up a day in a school. Every snag takes time, but the majority of the blame lies at the feet of COVID. I've known many of the staff members at Eastern for about 6 years now. And I can tell you that I have never seen them so wiped out, depleted, and defeated. They're bone tired, and there's no end in sight for them, no end to these hectic days. They can only take this high intensity and fatigue for so long, and I'm really afraid that they're not coming back next year because of the level of stress, and I can't blame them. The stress can also make them more susceptible to getting sick. Teachers and support staff are people who have people issues, health concerns, elderly family members, babies at home. And just as we have contracts that help protect workers from being taken advantage of and OSHA guidelines to make the physical environment safe, we have to have health standards that protect everyone. Without objection, the Eastern PTO sent a letter to Mayor Bowser and Chairman Mendelson in support of a COVID-19 vaccination mandate for all eligible students. And I would like to note that while we are in Ward 6, 2/3 of our student population is from Ward 7 and 8. As of yesterday, the Pfizer vaccine is fully approved for ages 5 to 11. And currently, student athletes ages 16 and older are required to be vaccinated, which is great, but not so great for the student theater group, the student club members, and students at indoor lunch. It makes no sense. Nothing is going to change until students are fully vaccinated. The hectic days, the call outs, the heightened angst among families, nothing will change. We need the required student immunization list to include COVID. It's really that simple, and it's only an issue if you make it one. I think the way to get where we need to go is with mobile medical units going to underserved neighborhoods that could cover school immunizations, school athletics participation forms, and even you can check in with the elderly. And I also think this hearing should have taken place like a year ago. And we need to be ahead of the curve instead of behind it. I'm thankful that you're having it now, and I thank you for your time.
Thank you, Ms. Scholl. Commissioner Adolfo, is he here? I do not see him. Shannon Hodge.
Good morning, Chairman Mendelson and members of the committee. My name is Shannon Hodge, and I'm the founding executive director of the DC Charter School Alliance. I'm once again grateful for the opportunity to share insights from the perspective of charter schools to help inform your decision-making about the legislation before you. Our school's top priority remains providing safe spaces to learn and work during the pandemic. This is why charter school leaders strongly support a COVID-19 vaccination requirement for students eligible for vaccination. However, school leaders are tremendously concerned about the implementation of student vaccine requirements, and they believe that careful coordination is necessary before any mandate is imposed. For example, It's inevitable that a vaccine mandate will have a disproportionate effect on students of color, who are most likely to be vaccine hesitant or resistant. Disparities in vaccination rates among Black residents continue to persist thanks to unequal healthcare access, historic mistrust of the medical establishment, and vaccine misinformation. Knowing what we know, it seems untenable to plan to exclude our most vulnerable students from school, especially after almost 18 months of learning loss from the pandemic. Vaccine eligibility for most students is relatively new and still not available for thousands of students. We're still figuring it out. Before implementation of a student vaccine mandate, city officials and school leaders need to be able to answer the many questions that will arise, including ones I provided in my written testimony. The failure to clearly, carefully, and swiftly deliberate and address these concerns before imposing a citywide student vaccine mandate will result in schools, parents, and students being left confused and frustrated. While we strongly support a vaccine mandate, the city cannot simply drop enforcement responsibility into the laps of already overextended school leaders. Any number of city government agencies, DC Health, the DME, OSSI, can be responsible for managing enforcement of mandates. Our schools simply do not have the bandwidth to manage another major mid-year policy shift, particularly one that requires coordination among many agencies and organizations. If this mandate does pass an obligation to schools to monitor student compliance, schools will experience a significant fiscal impact, and I've detailed examples of costs associated with the legislation in my written testimony. This fiscal impact would come on top of unexpected new costs schools have absorbed this year. Our schools didn't oppose the recent emergency legislation expanding the number of students eligible for virtual learning and increasing asymptomatic coronavirus testing requirements, despite the obvious cost associated with both. We did that because we're good partners and good members of the community. It was the right thing to do. But our schools cannot continue to absorb unfunded costs related to policies that are passed after budgets have already been set. Our school leaders want to do what's best for the health and safety of students and staff, but they need better collaboration and coordination with city leaders to truly help students recover from and thrive after the pandemic. Thank you for your time and attention to this matter, and I welcome your questions.
Thank you, Ms. Hodge. Shara Greer.
Good morning, Chairman Mendelson and members of the committee. I am Shara Greer. I'm the Policy Director at the Children's Law Center. I'm also a resident of the District of Columbia and a parent of 2 DC public school students. I am testifying today on behalf of the Children's Law Center, which fights so every DC child can grow up with a stable family, good health, and a quality education. I did submit more extensive written testimony, and I'm only going to touch on a few points here this morning. All of us have seen how this pandemic has disrupted the health, economic stability, and education of residents across the district. And this is why Children's Law Center strongly supports vaccination for everyone, including children when they become eligible. This is consistent with recommendations from both public health authorities and the American Academy of Pediatricians. Vaccines not only protect the vaccinated person from COVID, but also, especially from severe illness, but also reduce that person's risk of spreading the virus to others. For students, broad vaccination will protect the health and well-being of themselves, their families, and minimize further educational disruption and community spread of the virus. However, we have concerns actually similar to the previous witness, Ms. Hodges, about the predictable disparate impact on low-income families of color from a COVID vaccine mandate, and want to urge that steps be taken to address this and any unintended harmful consequences of vaccine mandate for students. As currently drafted, the consequence for not vaccinating your child for COVID is to be barred from attending school, which will lead to disruption of education and educational neglect referrals. And I know that's not what we want. We want is for people to get vaccinated. We also know from our experience with the rollout of the vaccine so far to adults and older children that there are inequities in access and utilization across the city, and that this will lead to mostly Black and brown families, largely in Ward 7 and 8, being disparately impacted by this policy. Therefore, we urge the council take several steps to mitigate this. First of all, recognize that we need a layered strategy. No one support will meet the diverse needs of the communities across the district. The council and the education sector have to work together to work on several strategies to increase COVID vaccination uptake among students. We urge DC to follow the CDC recommendations regarding student vaccination, in particular, providing the vaccine at schools, during school hours, before and after school, making it as easy as possible for students and families to access the vaccine. I want to make sure that we pair any COVID vaccine mandate with a clear roadmap So we know when students turn 5 or 12, when do they need to become vaccinated? There are a lot of details that need to be worked out to make sure that this is effective and does not have unintended consequences of keeping kids out of school. We have to make sure we engage with school leaders, local school advisory teams, community leaders, and youth to develop community supports. We have to have trusted stakeholders who can be in the community in relevant languages about vaccine safety and efficacy for caregivers who may be hesitant, understandably, about vaccinating their students. We also have to recognize there's some unique issues for older students. Students 12 and older have a say in whether or not they're vaccinated. And lastly, we urge a reasonable timeline for implementation. We're suggesting enforcement no earlier than school year 22-23, simply because of the necessary steps that will need to be needed to make this be successful. Public health leaders and pediatricians support vaccination for children who are eligible, and the mandate will increase the number of children who are vaccinated. However, before we can reasonably expect families to comply with the vaccine mandate for students, the city must take the time to reach out to parents and youth and provide them with the information and supports necessary for them to be comfortable with the vaccine. Further, we must make sure that problems with access to the vaccine are addressed and proper procedures and guidance necessary to implement the mandate are in place so this can be a successful effort in the city. Thank you. I look forward to any questions.
Thank you, Ms. Greer. Nathaniel Beers, is he here?
He doesn't appear to be here, Chairman.
Then we will move to Jason Parrish.
Morning. My name is Jason Parrish. I'm a resident of Ward 4. I'm the dad to 3 8-year-olds at Lafayette Elementary. Thank you for convening the hearing. I'm here because I strongly oppose the legislation, and I'll give you 3 quick points why. So first, the legislation, as I understand it, mandates COVID vaccination for district students that are deemed eligible to receive it by FDA. This phrasing is vague. It's not clear if the legislation would mandate vaccination for younger kids for whom the FDA probably today will authorize a vaccine on the basis of emergency use, but has not given full formal approval. So if the intent is to mandate vaccination on the basis of emergency use, the issue is that the bill is contrary to federal law. So I'm a parent, I'm here in that capacity, but I am also an attorney practicing in this area. And the issue is, bottom line, under the Federal Food, Drug, and Cosmetic Act and the regulations that go with the act, a vaccine authorized for emergency use has not been approved as a matter of law. And younger kids, therefore, are not deemed eligible to receive the vaccine and will not be deemed eligible until it receives full FDA approval. And I'm happy to speak with members of the council or your staff about this issue. It's a lot of very detailed stuff. So second, as a parent, I really oppose any effort to mandate vaccination of my young kids to the extent a vaccine has not received full approval. So my family believes in science. My kids have all of their required vaccines. We get our flu shots. But kids are at very low risk for developing serious disease. My view is that vaccination of young kids, except in exceptional circumstances, is not justified by the risk. I am a little bit struck by the pressure that I perceive has been put on FDA's advisory committee, which met yesterday, and on FDA more generally, to get to emergency use. And for this reason, my family is going to wait until the spring and possibly longer before considering vaccination. I know that we're not alone. There was an NPR story this morning that had a lot of good survey data on this. If the council passes this bill, there will be significant noncompliance. And DCPS cannot exclude unvaccinated kids from schools. That is legal challenges, and those are legal challenges where the district is not going to be on the winning side, and that is just going to undercut what you guys are attempting to accomplish. Another issue I would say is I would refer you to the Washington Post story on the FDA committee from last night. There is a further issue here. CDC, in my view, is not going to recommend the emergency use authorized vaccine for all kids age 5 through 11, at least not initially. So potentially this bill could be mandating vaccination on the basis of emergency use, where CDC has not actually recommended that those kids get vaccinated. CDC may, and I expect they will, probably tier this so that kids with more serious health conditions get vaccinated first, but we'll have to see later this week and next week. In closing, I know I'm over time, I would just say, you know, we've been through a lot in the last like 500 plus days. My kids have been troopers. Our teachers and school staff and principal have been extraordinary. But I'm done with like putting the burdens of this pandemic onto the kids. If you live in this community and you are worried about COVID, you need to go get vaccinated as an adult, and we can't put this on our kids anymore, and enough is enough. I would finally, just in the interest of being constructive, refer you to the measures that Governor Newsom enacted in California, which were referenced earlier. Those mandate vaccination in schools, but it's tied to full FDA approval, and it's a more flexible timing than what the current bill here is considering. So again, I'm happy to address questions or talk with you folks about potential revisions, and I'll leave it at that. Thank you.
Thank you, Mr. Parrish. Nikki D'Angelo.
Hello. Good morning, Chairman Mendelson, DC Council Committee of the Whole. My name is Nikki D'Angelo. I'm a Ward 5 resident, DCPS parent, former DC charter school teacher, and former DCPS central office employee. I'm testifying on behalf of Democrats for Education Reform DC, and I'm pleased to testify in support of Bill 24-423, Coronavirus Immunization of School Students and Early Childhood Workers Amendment Act 2021. I hope that this testimony offers a unique and helpful perspective. Vaccinated people are less likely to be hospitalized, become seriously ill, and die due to COVID-19. Ensuring our children and those who work with our children and young people get vaccinated is essential to putting communities and students' health first. Many school districts across the country are making similar decisions, including Fairfax County Schools, multiple New York public schools, and the entire state of Hawaii, which require all eligible student athletes to be vaccinated. Additionally, outbreaks of the new Delta variant have caused nearly 700 schools nationwide to return to hybrid or fully online learning. As a single working mother of a kindergartner, my child and I cannot afford to go backward, especially returning to online learning. His brain development and my ability to provide for him are at stake. We must do all we can to keep our students safe and in school. While I fully support this bill that will help keep students learning inside school buildings, I have a few concerns about how this bill will be implemented if passed. I'm concerned about the eligible students who do not get vaccinated, even with the mandate, and what will happen to them. We do not want to exacerbate inequities for our public school students by closing school doors to students who are not vaccinated, particularly when they do not have much of a say when it comes to their health. As such, this bill, if passed, should be paired with an effort to ensure eligible students and childcare staff have access to COVID-19 vaccine and information about the vaccine. Relatedly, I'm concerned about the rollout of vaccines for children ages 5 to 11. This age group could become eligible as early as November, as mentioned before. What has the DC government learned since its last comprehensive rollout, and how will this one be better? I would recommend a phased rollout of the mandate, with students 12 years old and up being mandated first, and then students under 11 years old and below being mandated afterwards, earliest in January. The DC Council must consider who the responsibility of providing vaccinations falls on: schools, pediatricians, and/or the Department of Health, and whether or not they have the requisite resources. Thank you for allowing me to testify in support of Bill 24-423. If the bill advances in the legislative process, I hope my concerns will be addressed. Thank you.
Thank you, Ms. D'Angelo. And we don't have a copy of your testimony if you'd provide a copy.
Absolutely.
Thank you. Kyle Myers. I don't think I see Kyle Myers here. Claire Bogard.
Hi, good morning, Chairman Mendelson and members of the committee. For the record, my name is Claire Bogard, and I'm a primary care pediatrician and the medical director of the COVID-19 vaccine program at Children's National Hospital. Thank you for the opportunity to present testimony on B24-423, the Coronavirus Immunization of School Students and Early Childhood Workers Amendment Act of 2021. Children's National has always recognized the importance of childhood vaccinations to keep both children and communities safe. Now, approximately 20 months into the COVID-19 pandemic, we will continue to prioritize vaccination for children and do our part in vaccinating our community's children as safely, efficiently, and equitably as possible. Children as young as 12 years of age were able to begin vaccination against COVID-19 in May of 2021. Since then, the committee has been able to vaccinate, the community has been able to vaccinate approximately 60% of youth 12 to 17 years of age. Yesterday, FDA advisory panel recommended the Pfizer COVID-19 vaccine for children ages 5 to 11. We anticipate by the end of next week, we will be able to start administering the 2-shot series to these patients. This is an incredible scientific and public health achievement, and Children's National is excited to play an important role in vaccinating this vulnerable population. Children's National Hospital will be offering the COVID-19 vaccine to the younger cohort who are inpatient in the hospital and at various ambulatory clinics. We will also be offering the vaccine to our primary care patients at the 8 primary care locations in the district and to some of our high-risk patients at our specialty offices. Our mobile unit is partnering with Children's School Services and will be going directly to elementary schools in Ward 7 and 8 to administer the vaccine. In addition to these services, we will be setting up vaccine-only clinics at the hospital, and we'll be organizing 2 mass vaccine events for our high-risk patients determined by medical condition and zip code. While Children's National is excited to begin vaccinating, we are still committed to caring for the acutely and critically ill patients in our hospital. Our emergency rooms and hospital floors are still surging as we navigate this unprecedented season of respiratory illnesses. All of our resources are being stretched and flexed to meet the many demands of the current healthcare environment, and we will continue to do so until the need subsides. Our primary care physicians are working hard to help children safely return to school, catching them up on routine vaccinations, completing health certificates, and performing COVID-19 tests for any patient with symptoms or exposure. While we experience an early rush of interest in vaccinations for our patients 12 and over, families currently require opportunity for significant conversation to address their concerns or questions about the COVID-19 vaccine that may extend over multiple visits. Our primary care providers are dedicated to having these conversations and vaccinating individuals when they are ready. When considering this bill, there are 3 critical items that need to be considered. The capacity for the healthcare system to meet the capacity to rapidly vaccinate substantial numbers of children, given the current strain on primary care practices and hospitals that may impact the deadline of any mandates. Second, many families will need access to trusted experts, including pediatricians, to help make a decision about getting their child vaccinated. And third, it's important that the COVID-19 vaccine be added to the already existing immunization registry to ensure all caring for children have access to accurate, up-to-date information, including pediatricians, schools, and families. So in conclusion, Children's National believes in the importance of vaccination to keep our children safe, and will leverage all of our available resources to make sure the families and patients can feel comfortable receiving the vaccine as quickly as possible. We thank you for the opportunity to testify on this bill and look forward to continuing the support of the district's efforts to protecting our children.
Thank you, Dr. Bogard. So we're going to have, I want to say 1 5-minute round, but I'm probably going to have a few more questions beyond a few minutes beyond 5 minutes. So we will struggle through this. Let me ask you, Dr. Bogard, do you know, is it correct that the federal law prohibits mandates of vaccines that have only been approved on an emergency basis?
Hey, I don't know that actually. I can get that information for you. When I heard that, I also was curious about that.
Well, let me ask Shara Greer. I believe she's an attorney. Do you know?
I had not heard that before. That's not my understanding when we looked at other jurisdictions who've implemented similar mandates. It's certainly something I would follow up on.
Okay, that would be helpful. Dr. Bogard, let me ask you this. The bill is written, says that everyone has to be vaccinated by December 15th. Now, we're probably not going to adopt this legislation until December. How long do you think it would take to, for people reasonably pursuing getting vaccinated? How long do you think it would take?
It's a really good question. I think there are a lot of children that need the vaccine still in age groups above, 12 and up, and of course the 5 to 11-year-olds. And with that being said, the younger cohort, we're expecting about a month later. So if you look in the current dynamic of the healthcare environment with a lot of people re-engaging in preventative care, requiring tests to get back into school, and then of course taking care of the sick and ill, I think it just needs to be a community response, right? The hospitals and doctors will do their best, but all of them are expressing concern that they won't be able to meet the early demand for the new vaccine. Not that they don't want to, they're just going to stretch as much as they can, but they are happy to have the support of DC Health and the local pharmacies as well. And so if the big context, it's difficult. I think the other piece I would add is we really do value that the patient and family autonomy and the shared decision-making that takes place in the exam room. So we all enjoy having these conversations. I know it sounds kind of crazy, but we like talking to parents about this and helping them understand the benefits of this vaccine. And so we would want to make sure that people feel like they get the chance to ask the questions that they need to make a good choice.
So you're not offering a date. Can you think about it and get back to us?
Sure. I think we're going to need the DC Health to help weigh in on that too. But yes, we can think about it and get back to you.
Well, if we're going to move forward with the legislation, we're going to have to put a date in there. And if anybody else has a suggestion, speak up in a moment. I want to ask a couple more questions of Dr. Bogard. So I know that there's a witness later who's going to testify that data from Israel reported that the vaccine effectiveness of the Pfizer BioNTech may be as low as 39%. Do you know anything about that information or report?
No, not specifically. I can speak a little bit to what Pfizer presented yesterday to the FDA. And so even though they're showing that out of the group they studied here, the efficacy being, over 90%, just under 91%, it also had a confidence interval that went as low as like the high 60s, which just means like when we expand it to larger numbers, we think the lowest protection it would give is like high 60s%. I think it's like 68% protection. So there's a wide range, but that's with any study, and we'll just know more as we expand. But right now it looks really good and really effective.
Without taking too much time, how does that compare with other vaccines, meaning like for flu or measles or?
It is very good. If this continues to be 90% effective, that is very strong. To put into context, when the messenger RNA vaccines came out last year, and we looked at it against the Alpha variant, those were the most effective vaccines that have ever been created. And we usually at baseline consider vaccines very effective if they're over 80% effective. So this is very strong.
Now, another argument that's going to be used against the vaccine is since the COVID vaccines were first administered, at least this is according to VAERS, the Vaccine Adverse Effects Reporting System. Since the COVID vaccines were first administered, at least 15,000 people have died within a few days of receiving the vaccine. I don't know if that's true, and if it is true, I don't know what the denominator is. Is it based on 100 million vaccines or on 100,000 vaccines? Do you know anything about that?
So I don't know that data specifically, but what I can tell you is if they thought it was from the vaccine itself, it would be the CDC and FDA take this incredibly seriously, and it would pause the administration until they figured it out. To put that into context, if you remember when they paused the Johnson & Johnson vaccine back in the spring, that was after 6 of these clots had been reported that were life-threatening. And so that was after, that was really 1 in a million side effect, and they quickly stopped the whole administration process. The VAERS, as a clinician, we are supposed to report anything that comes up after a vaccine is given. So if it's anxiety, if they have redness in their arm, if they vomit, even if they have other symptoms, technically we're supposed to report it. It's just to help give them more information and what to look for. So I don't know what those 15,000 cases were, but I can tell you as a clinician, we would have to report those kind of things, even if there was another explanation for them.
Well, we do know that the vaccines, and there are 3 right now for adults, are not 100% effective. So we do know that there are some folks who will get infected and will die. Mm-hmm. If there were 15,000 people who died and there were 15,000 who got the vaccine, that would be 100% dying. if there are 15,000 who died and there are, I think I saw a number of over 1 billion vaccines, are people vaccinated? That's a far different percentage. Now, I don't know that I can get more information out of you, but I think that's sort of relevant to my question here.
I think, yes, totally. The denominator is very important. I mean, with these vaccines around the world, we vaccinated half of the human population at this point, right? And all the data suggests that this keeps you safe out of the hospital and helps avoid death. If the 15, I'm sorry, I don't know that 15,000 number. If that's saying that people died from COVID, that's a different question than if they just died in general, right? So if someone had terminal cancer, got their COVID vaccine to protect them, and then 3 days later died, that would be reported as a death, but unlikely due to the vaccine itself, right? It was due to the baseline illness that the person had.
Chairman, I don't know where you're getting the 15,000 figure from. That doesn't sound correct based on anything I've heard out of FDA in terms of adverse events that are death caused by the vaccination, right? Like there may be correlation in terms of timing, as the doctor just pointed out, but that figure seems really high if we're attributing that as deaths that are adverse events caused by the vaccine.
Thank you for that. That's exactly what I mean. Those deaths are probably very unrelated to the vaccine. They are unrelated to the vaccine because the FDA would have stopped, the CDC would have stopped the administration of the vaccine with that number.
Another argument that we're going to hear later is that the COVID disease poses almost no risk to children 19 and under, and they have a 99.9973% survival rate. Do you know about that?
So COVID-19 affects adults worse than it affects children. However, working at the Children's Hospital, we know very personally that we see kids who are acutely and critically ill and some that die with COVID-19. We are trying we're doing our best to keep them safe and use the new technologies, but we believe in preventative medicine, right? We want every death of a child is traumatic for the community, right? And so our goal is to, if there is a life-saving medication out there, a life-saving vaccine, to encourage people to use it. The risks of getting the vaccine are far lower than the benefits of getting it. So the benefits outweigh the risks.
The last argument, treatments exist for COVID which are effective and when used prevent 85% of hospitalizations and deaths. They're talking about treatments that are not the vaccine. There wasn't anything specifically here, but I'm sure you've heard of some of the other treatments that are not vaccine that are applied. Can you speak to that?
Sure, there's different methods. The most prominent one that I think is the most successful currently is the monoclonal antibodies that we can give. Now, those are expensive and most of the time require a hospital stay in order to receive. And they're not offered to everyone. You have to hit a certain qualification of disease. With that being said, children are affected by coronavirus unrelated to just the physical consequences, right? Like they I think there was a crazy number that came out, and I can pull it up if you need, but the amount of kids, it has affected like over 200,000 kids in school this year. It's affected like 2,000 school districts have been affected by this. And that takes kids out of their academic and social environments, which they've missed so much this year. And then on top of it, there's two health consequences we have to be aware of. A significant portion of children are still reporting long COVID symptoms, which means they have symptoms based off the virus that last longer than a couple days, right? So after a few weeks of most colds, we expect the symptoms to go away, but there's a significant portion of children that have those symptoms that last much longer. And the other thing which scares me the most as a parent, even though the risk is low, is there's something called multi-inflammatory syndrome in children, multi-inflammatory syndrome in children. And we say MISI is the acronym for it. And that is when you might have had a mild reaction to your coronavirus a few weeks before. It's usually about 6 to 8 weeks before. And then your body goes into this large inflammatory response that essentially affects multiple different systems in your body. So we've seen people's hearts collapse. We've seen their liver be inflamed. And these kids are critically ill on life-saving medications in our hospital. And these are kids that were generally healthy beforehand. So it's a small proportion of patients that do get COVID, but if these are preventable by getting a vaccine that is safe, we highly recommend it.
So my last question, which is to Ms. Greer, is on the what I'm going to call the penalty. And that is, so we have in the law that certain vaccines have to be certain vaccines are required. This legislation would add to the list the COVID vaccine. There's a penalty, so to speak, that if a child doesn't get the vaccines, they cannot attend school. You spoke to that in your testimony, Ms. Greer. The question that I have is, so how do we ensure the mandate if we don't keep kids out of school, recognizing that the goal here is not to keep kids out of school, we want kids in school, but if we say, never mind, you can still come to school, then how do we ensure the mandate? Ms. Greer?
Well, that's the reason we're not saying to never enforce the mandate, but we are saying that you need to build in enough time to have it be a fair and reasonable expectation for the parents are able to comply. And that's complicated. I mean, that's looking at both access issues, building trust issues, logistical issues, the actually getting the forms in on time. Like there's a bunch of different, both really complicated community conversations to have and also just procedural bureaucratic things to resolve to make a reasonable deadline for parents to be able to comply with. So that's why we're saying push it back. Start the process now so that you're encouraging families to do all of this groundwork so that you're successful, so that when you get to that point, you're dealing with a very small number of families that you can work with individually. And so you're not pushing a bunch of kids out of school because we're rushing this and not giving parents time and not letting the process be properly prepared to let parents reasonably be able to comply with the mandate.
I think that's a fair point, but that's still, I'm going to say, and I don't mean this horribly, dodges the question. My recollection is that somewhere around 85, 90% of kids comply with the other vaccine mandates. That means there's some percentage that aren't. So this is not just unique to COVID. We could push back the deadline from December 15th. I think that makes sense. But we still have to deal with this issue. What do we do with the kids who don't get vaccinated?
I mean, I think there's two issues here. I mean, one of which you have an issue of equity, which is, while this is the law and you are supposed to be barred from school if you do not comply after you've been told you have 20 days to come up to speed with your current vaccine requirements, it's not widely enforced. OSCE has made a move this year to enforce it, and this is a much longer conversation about what we do with vaccine utilization and enforcement for other vaccines. I think if we take a different stand on how we're enforcing this vaccine versus other vaccines, that's an issue. I think we need to think about how we're enforcing vaccine requirements across the board. We're having this conversation. So that is an issue. The process, though, as it's supposed to work is schools are supposed to have an engagement with families about their compliance. And they're supposed to get a 20-day notice they're in non-compliance in a given time. And from our perspective, what we want is for kids to be vaccinated, not to push parents into a corner. And so giving them more of a time to adjust and feel comfortable and talk to their pediatrician, talk to their school leadership is the better path forward. And I'm not trying to dodge the issue. I mean, at a certain point, we have to get to a place to say this is not safe. And I did want to elaborate a point that Dr. Bogard made, which is it's not just about the individual student, it's about who they're going to spread it to and how many schools are going to get shut down and classrooms are going to get shut down and kids are going to miss school because we're not stopping the community spread and we're not stopping the spread in schools. So it's a much bigger issue than just the individual child and their individual risks and their parents saying, well, it's low risk of them getting ill. It's about the rest of the community and the rest of the school. And so I do think there's a certain point at which it has to be, now we have to enforce it. We have to be fair to parents. And there are really serious concerns the parents have about a new vaccine. There's a lot of misinformation about vaccines in the community. There's a lot of historical distrust of the medical establishment in parts of our community. And I don't think we can take that lightly. And we don't want to be having, a particular population pushed out of school because we're rushing things and not doing our groundwork.
Thank you. I'm way over my time, but I needed to ask those questions so we can move forward with the committee report. Thank you all. Turning to my colleagues, Councilmember Lewis George. She may have stepped out. Councilmember Henderson.
Thanks, Mr. Chairman. Do I only get 5 minutes?
Well, I'll be a little easy.
Okay. Thank you to all of the witnesses who testified. Shannon, I wanted to start with you. You suggested that there would be a cost to this particular legislation to charter schools. And, we took care in trying to just essentially just add this to the list of immunizations that are already required. So is there a cost associated now with our immunization requirements for measles, mumps, polio?
Yeah, this would be slightly different in terms of what we'd be asking of schools. So right now, I believe that information is transferred to the nurses at the schools who then, depending on the school, kind of take the lead in communicating out. With all the uncertainty and all the debate over this vaccine, it's going to take a lot more from schools. So they'll need to update their data systems and files. They'll need to train staff on new procedures. They'll have to engage in parent education and communication campaigns. They may need to dedicate their own staff time as opposed to a nurse that's been assigned if they happen to have one, to track compliance and documentation. They'll have to do parent follow-ups and referrals to vaccine administration sites. It's going to feel and look different for schools than the current requirements.
Okay. I'm not sure that I fully 100%. I understand that the COVID vaccine is different, but just from the administrative things that you just talked about are things that schools already have to do with the universal health certificates.
But the universal health certificates happen ideally in the summer before enrollment, right? So that's not a mid-year shift. All of that work happens before students are enrolled in school, and they're with vaccines that are generally already accepted. With the vaccine that's not accepted, schools will have to step in more than they currently have to do with the vaccines that are on the current immunization list.
Okay. Mr. Parrish, thank you so much for your testimony. I want to ask you this question, and I'm not asking it to be a brat, but I want to ask you this question. So the Supreme Court looked at the Indiana University's vaccine mandate, which was prior to the full approval of the Pfizer vaccine, and they chose not to intervene. Are you suggesting that the Supreme Court was wrong?
So several things. I don't think you can really draw any conclusions from the lack of Supreme Court action ever. I think you can only go based on what they actually say in an opinion. I think, and the chairman references, the argument that I am making is not that you can't mandate a vaccine that's approved on the basis of emergency use. It's different. What I'm saying is that under the bill as written, say I have young kids, the bill, say the intent that you all have is to mandate that they have vaccine to go to school. I don't get my kids vaccinated, we get kicked out of school. I or someone situated like that would then go to court and say, actually, we're not required by this law to get vaccinated because the FDA hasn't formally approved this. We are not deemed eligible, therefore, as a matter of law, let us back into school, right? So I think, it's a couple of things. I think that deemed eligible, the vagueness is the issue. It's not the mandating an emergency use vaccination. That's like a separate issue. And the law on that is actually pretty ambiguous. I think different people have different views. OLC at the Federal Department of Justice put out a memo last year that went through this. Personally, I found the legal reasoning a little bit deficient, right? And the truth is, not a lot of courts have weighed in on this, and not a lot of courts have definitely weighed in on it in the context of mandating vaccine.
But they have weighed in
for children.
COVID aside, right? COVID vaccine aside, we have had immunizations required for students to attend schools and be in in-person congregate childcare centers for decades.
I agree. And the law on that is well established. What we are talking about, though, is something a little bit different, and that is emergency use. And if you wanted to make the argument that you can't mandate a vaccine that is approved on the basis of emergency use, it's basically a constitutional rational basis review, right? Does the government have a rational basis to require this? And it's a balancing. And you get into looking at kids, looking at the risk profile. Does that justify mandating vaccine? What is the legitimate government interest that the government is trying to accomplish? And it's an open question. I don't know how that would come out, but that's not really the argument I'm sort of conveying to you with my testimony.
Okay. All right. Thank you, for participating and providing the testimony here. Shara, I hear you. Sorry, Shara, Miss Greer. Sorry. I hear your testimony for certain. And actually, while you were talking, and I think, Shannon presenting testimony as well, I pulled up the recent data in terms of the numbers of where we are in the district on just 12 to 17-year-olds, right? And there is a clear, stark divide. We have 67% of 12 to 17-year-olds in Ward 3 who have been fully vaccinated versus 21% in Ward 8, right? And so I think that is a question for sure. But I mean, to the chairman's point, if there is no mandate, then how do you shake loose the persistent hesitancy that we're kind of seeing here? I'm just sort of putting that out there, not really for a question, but one of my questions is, would you feel more comfortable if we, sorry, mini intern here. Would you feel more comfortable if we bifurcated the requirement? So for instance, right now, all student athletes or students who want to participate in extracurricular activities who are over the age of 12 must be vaccinated to participate. But one thing that you sort of raised is the older students have had more time, the families of older students have had more time. And so perhaps that deadline comes before any deadline for younger kids where, the approval is just coming or forthcoming. Any thoughts on that, Shara?
I do. Thank you, Councilman Henderson. I do think that makes sense. That's some things we were looking at San Diego's another school district that is implementing a vaccine mandate, and they had really clear timelines for the different age cohorts, and also address kids grow, and they're not going to stay 12 or 10 forever, and so also really making clear which age groups are supposed to be vaccinated, and when you turn into an age group that is eligible, what the timeline is for those students to become vaccinated. I think that level of one, I do think it makes sense because the vaccine for older youth has been out there longer. We don't even have it for the under 12s yet. And that makes a lot of sense. But I do really think that there hasn't been, and I have other people on this panel have expertise as well. We haven't done the work we really need to do to be getting the vaccine to all the older youth. I feel like we've not made it as accessible as it should be. I know there've been some efforts to have it on school campuses, but I know it is difficult for parents. Getting into a pediatrician is difficult. There's long waits for getting into pediatricians right now.
Oh yeah.
And that's if you have multiple kids, taking them to a pediatrician is not an easy thing. So I feel like we haven't made it as accessible as it should be, particularly in wards that don't have as many health clinics and access points. And then there's a lot of misinformation. And I do want to raise again that this is different than the other vaccines, which normally are administered to kids before they're 12, when they're entering school. There are some exceptions, but for kids who are immigrating from other countries and stuff. But for most of the time, you're getting your vaccines at 7 and 11. That are required for school attendance. This is a vaccine that's being required for older youth as well, and they do have a say in whether or not they get vaccinated. And we certainly have youth clients who don't want to be vaccinated. So we're not just addressing the parental responsibility, but doing the youth outreach too, to make sure that they too are getting the kind of information they need to be able to accept being vaccinated and to utilize vaccination.
Yeah,
which is really different than other school vaccinations.
Oh,
and if I could underscore Shara's point, we're treating this as if this were a school issue. It's not a school issue. This is a citywide issue where we need to do what's necessary to encourage everyone to get vaccinated. And ultimately, we're planning to use the stick of school enrollment to encourage that, which puts a lot of pressure on schools, where we as a city need to put in citywide initiatives to make this happen.
Okay. I will be, so the deadline for student athletes to be vaccinated is November 1st. Which I think is Monday. I'm interested to see, right? Are we going to have some schools who can't field teams anymore because of that? There was an article in the Washington Post that talked about, Coolidge High School football team and how, they finally got everyone to come around, but it was student led in terms of them making a decision that they wanted their season to continue. I know that the chairman is being generous here. So I just have two questions for Dr. Bogard from Children's. First off, can I just say, I love the fact that Children's always steps up to the plate and understands the assignment, right? The idea that you guys are going to be doing taking the mobile unit to schools. You've already decided you're going to do the clinics and then provide them at the primary care and all of that. Kudos to you and how grateful we are that you are one of our largest pediatric providers in the district. Because we have a lot of parents who are really nervous about how they're going to get access to that. I do have just a couple of really quick questions for you. With mobile units going to schools, one of the things that has been a concern around this access question is that a lot of providers have required parents to be present while the vaccine is being administered. Is that something that would also continue here?
It's a good question, actually. I think with emergency use authorization, we're required to get consent from the actual parent or guardian.
Yeah.
Now, each clinic can get that different ways. We don't necessarily need the parent to consent on this, on the spot while holding the child. You could do a consent process ahead of time if that helps with it. But given that it's emergency use authorization, which for the Pfizer vaccine is those 15 years and younger still, we do need the guardian. Now, if a 17-year-old walked into Children's National today and the parent had already signed, or the parent or guardian had signed the general consent form for our clinic, which includes routine vaccinations, the fully authorized Pfizer vaccine is now included in that. So that's like when a 17-year-old could walk in with a neighbor, an aunt, a stepmom, and be like, hey, she says, yes, I'm good to go, right? That kind of thing.
Okay. I have other questions, but I see Councilmember Nadeau patiently waiting.
You can always reach out if you need to.
Great. Thank you guys so much for your testimony and for being here today.
Thank you, Councilmember Henderson. Actually, Councilmember Robert White is next. Councilmember Robert White, are you here? I think you said you'd be stepping in and out. I don't see him.
Sorry, Chairman, I don't have any questions for this panel. Thank you.
Thank you. Councilmember Silverman, I think, has stepped out. Councilmember Nadeau.
Thank you, Chairman. And thank you all for your testimony. One of the things that I've observed as we've seen vaccine mandates roll out in the district and across the country is that they really have motivated people to get vaccinated, and also, I think, created more incentive for the carrots. We had to do it with our government employees. We're doing it with council employees. And I've seen, in Michigan, where I'm from, where all the hospitals are doing it. I mean, everybody's hospitals are doing it now, but you know what I mean? Where you get to the deadline and all of a sudden it's like 96%, right? And having that deadline and having that stick actually has moved people because they realize that this is the direction we're going in. And they're going to, if they haven't been motivated to do it before, then they're going to do it. And so I feel like, it's time for us to do this in a whole number of places, right? So we've done it in our government. Now we're looking at schools. I agree that we need to be doing more in terms of access, perhaps incentives. I know the AirPods were very exciting for a lot of older students, and the iPads and the scholarships, and those are really great. And also I give credit to DC Health for really trying to keep getting the incentives right. They try something, it wasn't really working, they try something else. So I guess what I really do want to talk with folks about is, can we get to a point where people believe, do any of you believe that a mandate can motivate people in addition to the other issues you've raised?
I can jump in and speak to that.
Oh, go ahead.
We all want to jump in. I think yes. I mean, that's one of the reasons why we're organizationally supporting the mandate. I mean, I think that it will move the needle. I think it'll get a lot more students vaccinated. I think that that is the right step to take. I just don't want to take it without all of the work so that it's not successful and it has a disproportionate impact on really vulnerable families, and that we end up pushing kids out of school when if we had taken more time to address some of the issues we know are coming.
Yeah.
This is not an unforeseeable problem.
Right.
That if we don't do it right, it can be a real problem. And so absolutely, I think it is a useful tool to really get more students vaccinated, and we need more students vaccinated. I mean, I think Ms. Hodge talked about this, we're seeing it with our clients, having students continually be going into quarantine is really disruptive. We've had enough educational disruption. It's really hard on schools. It's hard on students. They're bringing it home to their families. It's not helping with community spread. We need to find a way to get more kids vaccinated, and we're about to hopefully be able to vaccinate a larger group of kids.
Exactly.
We need to do it right.
And, and with little kids, so I have 2 little kids, right? My kids aren't going to be eligible for a vaccine until next year earliest, right? Like the under 5s, we're just kind of holding our breath.
Maybe
but to me, what's that?
Maybe before Christmas. I have a 4-year-old too.
Oh, all right, doctor. Thank you for that. I appreciate it. Solidarity with all the parents, by the way, and the point about access to pediatricians' offices right now. Oh my God. I mean, frankly, I wouldn't be surviving right now if it weren't for the new PM pediatrics entering the market, because I can't get in anywhere otherwise. And we're doing urgent care for everything. And it's a nightmare, and parents are dealing with this, right? But the other piece of this bill, so to close the loop on that, I think what Ms. Greer was saying earlier about more and more kids being vaccinated, the better. For me, my kid's 4 in an elementary school. If all the kids older than her are vaccinated, then she's safer than she was the day before, right? Even though she's not vaccinated. And that's the way that we have to think about it from a public health perspective. When you look at the precedents in the courts, like, Jacobson v. Massachusetts back in the smallpox era, where the Supreme Court said public health trumps the other factors in the case, and the government has the right to mandate a vaccine. That's the way we're thinking about this right now. Now, the other piece of this bill that's really important, and I thank Councilmember Henderson for working with me on this, is knowing what we know already about the challenges of getting children inoculated with the things that are required that we've been talking about. And frankly, I believe part of it is a paperwork issue. That's why we really wanted to integrate the electronic transmission of records piece here, because getting into the pediatrician's office, sometimes paying for each form that has to be filled out, multiply that by the number of kids that you're getting vaccinated or doing the health approvals for every year, it's been a real burden on parents. And so I don't think it's a surprise when you think about all that bureaucracy that not all of our children have their regular inoculations properly documented in our school system. So my hope is that piece of this bill, this electronic submission, really can help families and help schools be organized so we know better really who isn't inoculated as opposed to who just doesn't have their paperwork in. So I'm interested if anybody has thoughts on that. I know that, those mandates have been around a long time. We don't enforce them. I've not really heard of them being enforced other than for sports. And that's because we want kids in school, but we also need to make sure they're healthy. So that I'm very interested in how people feel about that piece of the bill. Perhaps it's not controversial, and that's why it doesn't come up.
I think that's an important part of the bill. My concern is that not all schools use those systems in the same way. So there may also have to be some education of some school staff and leaders on how to interact with those systems. And I would also be curious to know from your discussion with the executive later, whether or not that capacity actually exists to communicate that in a speedy way. Because if we're looking at a December 15th deadline, then you probably need that information tomorrow or as soon as the bill is voted on. And I just don't know how soon that information can be transmitted.
Well, now that we're using MyIR, I think there's a way to do it. And that was sort of what we were contemplating in this piece of the bill, was that now that I have it for myself, I'm always playing around with this tech to see how it works for other people. And you can add your kids in there. And it's basically a request. If your record isn't in there, then you ask the doctor to send it to DC Health, and then it should be showing up in MyIR. So I think that the tech is there. the education, you're right, we definitely have to work.
And potentially the access to the tech, depending on which families we're talking about.
Right. But I'm thinking though, you don't necessarily have to have it yourself as long as the doctor's communicating to DC Health. So.
And I think that would be a great question to ask the executive, how much that's happening and then how quick they can turn around that information.
Yeah. Great. I'm sorry, I can be finished, but it looked like Mr. Parrish wanted to jump in.
Yeah, I just wanted to address your earlier question about the benefit of mandates. And I agree, mandates can be valuable. I've supported a mandate for, my own workplace. I think, the issue here is that kids are different. And I think a lot of parents who are rule followers, and we have a lot of those in DC, they like to do the right thing. I would be one of them. But I just need, if the bill is not going to tie the requirement to full FDA approval, then, I would just prefer some time to see how this kind of unrolls over 4 or 6 months. Put the compliance date in March, put it at the beginning of the next school year. I think, I'm concerned about my kids, but I recognize the risk relative is very, very low. I'm more concerned about them getting flu. I mean, we've all had like respiratory viruses the last month or two.
Been horrible.
There's a lot of stuff out there that can, impact a kid. COVID, for me, at least, it's pretty low down on the list, but I have healthy kids and I realize not everyone does.
I'll just say with that too, sorry to interrupt, but
No.
there will be, presumably, the more people that get vaccinated, the lower COVID goes, just like we've seen in DC in the past. The rules will change based off of what the CDC guidelines are for those that are vaccinated. And so there will be these like inherent incentives to people, right? So as a vaccinated person, typically, and a vaccinated person in a primarily vaccinated community, we really don't have to quarantine right now if we've been exposed until we get symptoms. And I anticipate that those will be the guidelines that are followed later. Right now, schools don't follow that because it's primarily an unvaccinated population. So I just say, like, even though we're talking about this particular mandate, there will be different incentives that are just part of the process as we go forward through the months. And I respect every parent that wants time to talk about it and think about it. We've given the vaccine to about 3,000 kids, right? Like that's a small proportion. I feel like it's okay to be curious and thoughtful about it. I just want to make sure that those parents can get their questions answered so they don't feel pressure. That's a very important relationship with doctors. And we want to keep that trust.
Right.
Can I say something very quickly? I mean, if we're talking about building back better in a lot of different ways, can we build back better for this? I mean, we're spending how much on this asymptomatic testing process, which is just stupid. What if we allocated that money to doing the mobile unit, to getting ahead of this and not putting the pressure on the schools or the teachers, or the parents, by getting the mobile units into the neighborhoods who need it, and just get it all taken care of right there. There's a doctor there, they can ask their questions. So many things can be, healthcare things can be alleviated by just making that initial investment.
I wouldn't cut back on testing, but certainly if there is a funding issue, we should resolve it. I'm not sure it's a funding issue. I think it's more of a strategy and will issue. And that's why we have these conversations so the public can come out and say, hey, DC government, we want you to do more in this area. So thanks for that. Thank you, Chairman.
Thank you. We have one more Councilmember Pinto. Councilmember Pinto. All right, she's not answering, so we will move on. I want to thank each of you for your testimony. It's been very helpful. I'll remind folks in case anybody wants to supplement their comments. And I think there was one witness who didn't have a written statement. The record closes in 2 weeks, 5 p.m. on Wednesday, November 10th. So you all are excused, and I'm going to call the remaining non-government witnesses. There's Sarah Lewis, who's interim CEO at Achievement Prep Public Charter School. Kelly Smith, who's Chief Operating Officer and Finance Officer at Perry Street Preparatory Public Charter School. Maren Wandwosen. David Sippos, who is a sophomore at School Without Walls. Kathleen Boylan, who's listed as a Dorothy Day Catholic worker. Valerie Jablow, Scott Goldstein, who's for some reason listed as a public witness, but I know he's with Empower Ed. Claudia Silva-Russo, who's Director of Family and Community Engagement at Latin American Montessori Bilingual, or LAM Public Charter School. Benjamin Bergman, who's an ANC Commissioner with ANC 3D, Sarah Raskin, and Matthew Grace. And I'm going to start calling folks, assuming they're being let in. Sarah Lewis, are you here?
She's not here, Chairman.
All right, then we will go to Kelly Smith.
Thank you. Thank you for allowing me to testify today. My name is Kelly Smith. I'm a DC resident, a parent of 4 children attending DC public schools, and a charter school leader at Perry Street Prep Public Charter School in Ward 5. I'm speaking to you in clear support of a COVID-19 vaccine access for children and a mandate for eligible children in line with current vaccine requirements. But I am here with the urgent request that our council reconsider the timeline presented in this legislation and critically think about the inequitable impact of this potential barrier to children accessing their education. At Perry Street Prep, we believe deeply in the community model of utilizing schools as a cornerstone. We provide social workers, mental health clinicians, family services, a food bank, and more. We do this all to aid in the provision of education to students. Optimistically, one could believe this legislation has been placed squarely in the hands of schools to leverage compliance in the hopes of aiding in education by creating safer schools. But if we are actually going to pull this off, the council must consider in this legislation that schools need access to clinicians for our families. We need access to health educators for our students. We need vaccine clinics on site in our schools available to students without parents having to take time off work. We desperately need a database that can track compliance accurately for all students and all vaccines. We need these practical matters handled with great urgency to keep our students safe and our schools operational. Quite often, we utilize compulsory education as a mechanism to accomplish the work of medical and social service agencies in our city. While there's an obvious efficiency to this method, we cannot turn a blind eye to the distraction this creates for schools away from our educational mission. As a school leader, I already spend my weekends informing parents when their child has tested positive for COVID-19 through the OSSI testing program. In the evenings, I spend my time counseling them on guidance for their family's quarantine when the Department of Health does not respond. Please do not ask us to spend our time counseling families about vaccine questions and their own children's healthcare needs. We are not qualified to do this work. Please let me and my fellow educators focus on the immense and devastating amount of time and learning our students have lost since the pandemic began. We have to pull off a Herculean effort to get all of our students back on the road to educational success. Please know that Perry Street Prep could not be more proud of the implementation of one of the first COVID vaccines for our employees, requiring them by August 6th to be fully vaccinated. It was a hard decision, but it helped us ensure the safest environment possible. With this said, getting to August 6th was not easy. It took months of tireless advocacy for access to the actual vaccine administration, even though our educators had become eligible. Once the first wave of employees were vaccinated, we continued to engage in months of extensive staff education. We provided access to healthcare experts who could answer questions and speak directly to cultural hesitancy concerns. We provided regular and frequent communication and consultation through the entire process. We provided access to technology to support scheduling consultation appointments. We provided financial support to cover the cost of transportation, and we provided paid time off for the actual administration of the vaccine and recovery from its side effects. We provided all of these things to our employees prior to implementing a mandate. Our families and DC school children deserve the same process and support in getting vaccinated during this challenging time. I urge you to create a plan before a mandate that gives all of our families the support they need prior to us considering stripping away their right to a free and appropriate education. Thank you.
Thank you, Ms. Smith. Maren Wandwosen. Is she here? I do not see her. Moran Wandwosen. David Sippos.
Good morning. Actually, sorry, it's afternoon. It's a little loud where I am, so I apologize for that. Thank you for the opportunity to be here today. My name is David Sippos. I'm a sophomore at Schools at Walls High School. I'm here in strong support of this bill to establish a student vaccine mandate. Vaccine mandates are the most powerful and most effective tools we can use to fight COVID-19, and they are desperately needed. DC and the country have seen a rise in pediatric COVID cases since the school year began a few months ago. We have also seen a maddening rise in the threshold for herd immunity, driven by the Delta variant. Students 12 to 17 make up around 7.5% of the population, meaning mandate would push us significantly closer to the herd immunity threshold. Mandating the vaccine for younger students, now that it is set to be approved in the coming weeks or days, would raise the percentage even further. The safety of the country and all of its people cannot be jeopardized due to the irrational objections of a minute minority, objections fueled by misinformation. My school has reported 2 pediatric cases since the school year began. And while we have done well, we have worn masks for months, as I am doing right now. I am in school right now and I'm wearing a mask. A mask mandate is sensible and important to student safety, but it is burdensome, and a vaccine mandate would allow us to eventually leave those mask mandates behind. I've been vaccinated since the vaccine was made available to students my age, and a mandate is simply common sense. Vaccines are safe and effective, and it is dangerous to wait any longer to impose a student vaccine mandate. Students like myself are the most qualified to speak on the subject, which is an issue of our safety, the safety of our loved ones, and the safety of the entire country. I urge the council to quickly pass this bill and ensure a COVID-free 2022. Thank you.
Thank you, Mr. Sippos. And if you could provide us with a copy of your statement, I would appreciate that. Kathleen Boylan. You are muted. There, you look now.
Hi. I'm coming on. Sorry.
But you're coming like your internet unstable. Yeah. I'm hesitating a little. You might turn off your video. That might improve the transmission. Are you simultaneously watching this on YouTube or?
I'm in Washington.
Because that's interfering with the transmission. All right, we've muted you because we were getting a lot of static. What I believe might be happening in part is that you are simultaneously watching this separate from Zoom, and that would be interfering with the transmission. Try unmuting yourself and we'll see where we are. Yeah, this is not working. Did you just mute her? The only thing I can suggest is that if you turn off your video, sometimes that improves the transmission. And if there's another computer that is watching this, that would be interfering with the transmission. We're still getting some sort of interference.
Close this out and come back. Close this out and come back.
The static went away.
Oh, okay. Now what do I do?
Please talk quickly before the static comes back.
Okay. Hi. I oppose the bill to mandate COVID vaccines for children 5 to 11 because, one, the COVID vaccines authorized for use in the United States only have emergency use authorization. Federal law prohibits mandates for EUA vaccines. EUA products are by definition experimental, which requires people to be given the right to refuse them. According to the Nuremberg Code, no one may be coerced to participate in a medical experiment. If a vaccine has been issued EUA by the FDA, it is not fully licensed and must be voluntary. A private party, such as an employer, a school, a hospital, cannot circumvent the EUA law, which prohibits mandates. And by the way, I have the federal law. It's Title 21 USC 360 BBB-3 and a few other letters. And I'd like to point out that a federal court held that the United States military could not mandate EUA vaccines to soldiers. That was in Doe number 1 versus Rumsfeld. So you could look that up. The emergency use authorization does not mean that the FDA has evaluated all safety and efficacy data. In July 2021, the CDC reported that the fully vaccinated could still become infected and be capable of transmitting the virus to others. Data from Israel reported that vaccine effectiveness for the experimental Pfizer vaccine may be as low as 39%. The 3 COVID vaccine manufacturers are shielded from liability under the PrEP Act. I believe those companies are more dedicated to their own profit than to our safety. Number 2, the second reason, according to the Vaccine Adverse Effects Reporting System, or VAERS, which is, by the way, a CDC article or program. So I don't know why the doctor doesn't, it seems strange and not understanding it, the other doctor. According to that, since the COVID vaccines were first administered, at least 15,000 people have died within a few days of receiving the vaccine. And there have been hundreds of thousands of adverse reactions. And I wonder too, why haven't these vaccines been pulled? I wondered, like the doctor, this is very strange. Number 3, given that COVID disease poses almost no risk to children 19 and under, and that they have a 99.9973% survival rate if they do become infected, what possible rationale can the FDA and CDC and the DC City Council offer for subjecting young children to such a dangerous experiment? Consider also that the vaccines were only tested for 9 months, so there are no long-term studies of their effects. No one knows what will happen in the future. All the little children getting this vaccine will be part of the experiment. Do not experiment with your children. Number 4, vaccinating children for the benefit of adults is an unproven hypothetical benefit, according to Peter Dashi, PhD, of the University of Maryland School of Pharmacy. Number 5, very important, treatments exist for COVID, which are effective and inexpensive, and when used, prevent 85% of hospitalizations and deaths. Read or interview, call him up, ask him to testify in DC. Dr. Peter McCullough from down in Texas, Baylor University in Texas. Ask him about the early treatment he and hundreds of doctors are using very effectively. Now, here's the important part. Dr. Fauci refused to recommend the use of treatments because had he done so, he could not have obtained the emergency use authorization for the vaccines, including the NIH patented Moderna vaccine. The EUA can only be obtained if there are no treatments, but there are treatments. So we shouldn't even be discussing this because they shouldn't be approved yet anyway. Tested only 9 months. Number 6, Dr. Fauci and the NIH funded gain-of-function experiments on the coronavirus in Wuhan, China, and then lied by denying such in a well-publicized congressional hearing. Number 7, please read the information at Children's Health Defense and the National Vaccine Information Center and contact Dr. Peter McCullough. Please vote no on this dangerous bill. I'd just like to add that I worry that school children, because if vaccines are distributed, but I was happy to hear that EUA vaccines require the approval of the parents. Thank God, that's good, but I don't want them to get the vaccine at all. But, you know, DC passed the law that said 11-year-old children can get vaccines without their parents' knowledge of consent. That's a very dangerous law. So the FDA, I listened to some of the hearing yesterday. They recommended the vaccine, but they did not recommend mandating them. So please, the FDA and the CDC, while they are highly funded by the pharmaceutical agencies, we can make them be responsible regulators and protectors of our safety, our life, our children, and everyone. Thank you very much for your attention.
Thank you, Ms. Boylan. Valerie Jablow.
My name is Valerie Jablow. As a DCPS parent, I'm here to testify that we need this legislation because
We can hardly hear you. Can you speak up or do something?
Sorry. I am testifying to say that we need this legislation because COVID is still with us. I say that because about 50,000 students in DC's publicly funded schools who are not yet eligible for COVID vaccination, along with thousands who are eligible but remain unvaccinated, are currently attending school in person 5 days a week by mayoral fiat, while this body is holding virtual hearings.
Jablow, I'm sorry to interrupt, but you're still very hard to hear. Maybe get closer to your speaker.
I'm shutting off my video. I'm sorry that my internet's terrible. That disconnect in the middle of DC's worst pandemic in a century is rooted in the politicizing of effective public health measures, including instituting a COVID vaccine mandate for school children. Though such politicizing poses dangers for everyone, DC's Black and brown residents continue to be disproportionately harmed by COVID. That is why this legislation is important, but there are many more reasons. Consider that we have non-COVID vaccines currently mandated for attendance in our schools. Whatever opposition exists to those vaccines has never stopped any official in DC from mandating them for school attendance. The COVID vaccine is no different, even with emergency authorization. In fact, the DOJ made a judgment on this in July 2021. I have tweeted this out to you. Yet we have been treating the COVID vaccine differently, all the while protecting adults like all of us here with virtual options that we are denying to all but 350 kids in DCPS. As a society, we decided a long time ago that it wasn't acceptable for kids to suffer from and occasionally die of common vaccine preventable illnesses like measles, tetanus, and polio. We also know that mandating vaccination of school-aged children is an effective public health measure that keeps not just our children safe, but entire communities and schools. It's dangerous to pretend that common, highly transmissible, and deadly COVID is any different. So I appreciate this legislation, and I'm also appalled that we need to have it. Mayoral control of schools was supposed to ensure direct accountability in our schools, but we DCPS parents have only a once in 4-year shot to directly change every bad idea that endangers our schools and or the people in them. So legislative fixes like this have become as common as hearings in which we often beg elected officials to provide basics in our schools. Right now, that includes this mandate in the wake of months of advocacy for functional HVAC in bathrooms, adequate soap and water, more testing and contact tracing, and a virtual option like the one all of us here enjoy at this moment. Now is not the time to debate a vaccine mandate in our schools. We know school vaccine mandates work, which is why we have had them for many decades. Please just mandate the COVID vaccine for all eligible DC students. And please also figure out how to effectively and quickly roll out COVID vaccine to all eligible DC school children. School-based immunization clinics may be a way to meet families literally where their children are and have been used extensively in our country. Thank you.
Thank you, Ms. Jablow. Scott Goldstein.
Good afternoon. And Chairman, yes, I am testifying today as an individual and not representing Empower Ed, but I'm here to testify as a parent and also with my view as an educator. I'm testifying today to strongly support this legislation and the intention of making sure every single eligible human in our schools is vaccinated as soon as possible. Our teachers are now covered by the vaccine mandate, and students should be as well once eligible. As a parent, I can't wait to get my 5-year-old vaccinated. I hope by the end of next week. I had a case of what I would call moderate COVID myself. I still suffer from long haul symptoms. My 5-year-old tested positive as well, but had virtually no symptoms. And I heard someone say earlier that kids don't get severe cases. But as someone who had a child with virtually no symptoms, I worry every day about the long-term hidden consequences that I ask you to take into consideration, as there's considerable evidence that there might be long-term consequences even with mild cases down the road. I would anticipate in certain parts of the city we'll see, and not in others, where there might be a rush to get the vaccine. So I would anticipate we need a really focused plan to help students get vaccinated, ideally including vaccination sites at schools and mobile vaccination units. My pediatrician, for example, has said that she will not be doing the COVID vaccine because she can't handle the number of appointments, which could put a large strain on our pharmacies. I also feel a deep sense of inequity that the parents who are least able to work from home or shift their schedule on a dime are those who are suffering the most from having to stay at home when kids are forced into quarantine by COVID spread at their children's schools. So that's why ensuring that all students across the city have the vaccine as soon as possible is a moral imperative, but also why we must be very well prepared to roll out the children's vaccine in every part of the city. Of course, we might have to consider the timeline in this bill once we see what the supply is like. And I understand if we're talking about pushing it back a month or so, but please don't push it back to next school year. If the mandate goes into effect, you shouldn't be able to cross the street without seeing a sign and the date requirement on it at an address of the closest place to get the shot, or a QR code that leads you to a list of the closest places to get the shot. As an advocate, I know you have to be creative in making sure your message gets to the people who don't normally engage, and that requires a lot of creativity. It's not the kind of creativity we usually see from government in this kind of work, but we need it right now. As an educator, as someone who works with teachers every day, I will say that we have to do all we can to relieve the pressure on educators in schools right now. In my 15 years in education, I've never seen educators stress this high. This year, DCPS started with the highest number of teacher vacancies in any year in recent memory, with 160 vacancies to start the year. We're still at 106 as of Monday, but COVID's making this worse. Anytime someone calls out sick, educators are forced to cover classes. Educators across the system report they're routinely getting no planning periods this year because subs are in short supply and coverage is desperately needed. The vaccine mandates help teachers, but anything we can do to limit COVID spread in schools and people staying home can ease the current crisis. So the vaccine mandate for students is one more tool we can use to do this, and we need it this year. Overall, this should be common sense. It's just how we protect each other. Thank you.
Thank you, Mr. Goldstein. It would help if we have a copy of your statement.
As soon as I read it out, I will send it to you. Thank you.
Thank you. Claudia Silva-Russo.
Hello. Good evening, Chairman Mendelson, guests, and member of this committee. My name is Claudia Silva-Russo. I'm a Director of Family and Community Engagement of Latin American Montessori Bilingual Public Charter School, well known as LAM-PCS. Our school is located in Ward 4, DC, and we serve 533 students for pre-K3 to 5th grade. Thank you for the opportunity to speak with you about the student vaccine mandate. As a school leader, I support 100% the requirement of the vaccination of students of all ages and school levels. The price we all have to pay the last 2 years demands concrete and energetic actions. However, I strongly believe that the enforcement of this requirement should not not fall to the schools. The COVID pandemic demands our school system to reinvent itself and respond to situations we could never imagine. But our students and our institution also have to pay the price for it. The COVID pandemic showed how vulnerable our students and families could be. And it was sad to confirm how some families could pull together more and better resources than others. At LAM, we work with families to address multiple needs, including technology access, childcare, transportation issues, attendance, student falling behind, you name it. As you already know, students at risk and students of color were disproportionately affected more than others. Also, unfortunately, vaccination is not any different. Access to information or misinformation, health coverage, access to vaccine itself will count against some of our families. A hasty and not planned vaccination process can turn the solution to this nightmare into another factor of disadvantage between some students in comparison to others. Also, after 2 years of inventing and reinventing ways to teach and reach out to our students, the pandemic takes a toll in our learning institutions. Teachers and administrators are burning out all over the country. Our administrators are doing all they can to manage policies and procedures to ensure each one of the students is safe within the school walls. Some of us are now adding new duties or new job descriptions, such as quarantine expert, meal distribution, dedicated aides. I can imagine how I will ask my school staff and administrators to take yet another responsibility on their shoulders and guarantee the success of the student vaccination mandate process for all our students. Chairman Mendelson and members of this committee, I know that all public schools have a responsibility that reach beyond the classroom and that ensuring immunization are up to date is just one of them. However, in this health emergency, the school need to be part of a system capable to absorbing this mandated impact. Quoting someone in this meeting, it is not a school issue, it's a city issue. I also want to be sure we are prioritizing our students with restricted access to resources. I do not want to see the mandate become another obstacle to school success. Thank you for your time and consideration, and I'm happy to answer any question you may have.
Thank you. I don't have a copy of your statement, so if you could provide that, please.
I will.
Benjamin Bergman.
Good afternoon, council members and staff. My name is Ben Bergman. I live in Ward 3. I'm currently serving my first term as a ANC Commissioner in ANC 3D. Today, I'm testifying in strong support of the bill. At our September meeting, after Councilmember Henderson and others on the council wrote a letter encouraging the mayor to strengthen vaccination requirements for teachers and other adults, and there was a letter that was sent in August, ANC 3D unanimously approved a resolution asking the mayor to listen to the council and amend the order. And as that resolution came a month before this bill was introduced, obviously ANC 3D has not opined on this bill, although I've placed it on our agenda for our November meeting. But so as a result, although I think that this is sort of the next logical step from what the ANC has already endorsed, I'm testifying this morning completely on behalf of myself as a DC resident and a father of 2 young children, one of whom is enrolled at our local DCPS elementary school and the other at a local daycare center. In our September resolution, ANC 3D noted that with the full FDA approval for the Pfizer vaccine and the coming approvals that are coming and expected for the other vaccines, we shouldn't be having a debate any longer about the reasonableness of mandating vaccinations against COVID-19. The vaccine is safe, it's effective. This has been fully vetted, especially when paired with masking and other mitigation techniques. And when faced with this global pandemic that has disrupted everyone's lives, but especially children's lives, we cannot let people who have been influenced by misinformation or conspiracy theories bully policymakers into suboptimal policy decisions that aren't in line with what we already do with respect to many other vaccinations. As you are all aware, as has been said today many times, we already require vaccinations for a number of different illnesses for students and staff before they can come to school. It makes sense to do that here for COVID-19, especially given the gravity. This morning, Councilmember White noted that the flu shot is not required as a vaccination for DC school students, which is true. And that's not because it's not important, but likely because of the administrative burden of having a vaccine that comes out in the middle of the year and getting that administered and reported, something that we have heard from many witnesses today about this vaccine. I'll note that Massachusetts actually was the first state last year to require public school students to get the flu vaccine. And perhaps as we go forward, the district can use this experience, which I hope will happen, as potentially a learning opportunity for that vaccine, which is also essential and is becoming a requirement at many colleges and now in one state for public school students. So I'll conclude and thank you all for your time, and thank you especially to Councilmember Henderson for leading the way on this. I really appreciate it.
Thank you, Commissioner. Sarah Raskin.
Good afternoon, Chairman Mendelson, esteemed council members, and fellow DC residents. My name is Dr. Sarah Elaine Raskin. I live in Ward 5. My children attend Breakthrough Montessori Public Charter School, and my sister is a 20+ year teaching veteran in both DCPS and public charters. I am a health services delivery scholar, and I teach public health emergency preparedness at the university level. My comments reflect those of other public health professionals and community organizers whose children attend DCPSs and charters citywide. First of all, I want to mention that I just emailed to the council a truth checking on this claim about the VAERS and the 150,000 people who have died. That is factually incorrect, and I'd like to submit it to record. I'll also be glad to post it here if I can in the chat. Healthy debate and transparent governance are essential to stopping the spread and moving to the next, hopefully less heavy phase of this pandemic. Yet my peers and I wonder how we can consider vaccine mandates with immediate deadlines for kids before we have a detailed plan for how the city will distribute kids' vaccines as widely, quickly, and equitably as possible. Successful plans to prevent, mitigate, and minimize the harmful effects of public health emergencies leverage existing community assets, preserve limited resources, build on established relationships of trust, account for changing circumstances, and prioritize equity for both ethical and practical reasons. The unevenness of the COVID-19 vaccine uptake among teens in DC tells us we must better prepare for younger children. For example, we actually don't fully understand why less than a quarter of teens in Ward 7 and 8 have not taken up the vaccine, although a likely factor is that they lack convenient access to routine healthcare that takes seriously and respects their individual beliefs, values, and concerns. Fortunately, Biden plan allocations to vaccinate younger children in pediatricians' offices will facilitate the private one-on-one conversations that help families more comfortably make the right decision for themselves at that time or at future points. For example, when the vaccine is fully authorized instead of only for emergency use, or when mandates reflect the city's preparedness to roll them out. The Biden plan, which is assumedly mirrored in the mayor's heretofore obscured strategy, makes sense for families who have an established relationship with a provider or convenient access to a pharmacy. And I must note here that the Biden plan does not suggest that all pharmacies will deliver the vaccine, but instead that they can make their own determinations. We know that many under-resourced families don't have access to either of these resources. Moreover, this plan adds an untenable volume of appointment requests to providers who are already overburdened by routine patient caseloads, RSV and flu, and COVID testing. It is premature to consider a mandate within this calendar year until we have confidence in a pressure release valve on our overly taxed health system. The federal plan, and seemingly the city's plan that will follow, overlooks community-based settings where we can vaccinate as many children as quickly as possible, and because these locations are found citywide, as equitably as possible. DCPS and charter school administrators have told my collaborators and I that they're eager to host city-led vaccine delivery centers that are convenient for families on Saturdays, for example, or at school pickup times. These neighborhood resources leverage existing infrastructure, community relationships, and critically the trust that it's going to take to scale up vaccinations and stop the spread. Families across all 8 wards know their schools not only as nearby destinations for learning, but also where their kids make friends, play sports, perform in talent shows, and where families lean on essential resources, groceries, laptops, and the compassionate ear of a trusted teacher, social worker, or fellow parent. My 9-year-old daughter and I joke about her willingness to get a COVID vaccine and a Happy Meal at a drive-through, but our hunger for such convenience, widespread distribution, and brand recognition trust of kids' COVID vaccines across the city, across the country is real. Before we start talking mandates within this calendar year or even the beginning of the next, let's first focus our brainpower and goodwill on strengthening distribution through existing community-based settings, such as schools. Thank you for your time.
Thank you, Ms. Raskin. Matthew Grace.
Good afternoon. I'm a parent of 2 children under age 3. I live in Ward 6, and I'm really concerned with this proposed mandate here. One correction, I would like to echo what Ms. Raskin said. It was not 150,000. There are over 15,000 reported deaths on VAERS currently from the vaccine, and over 700,000 vaccine injuries reported from VAERS. You can shake your hand all you want. I'll take my time, thanks. According to Harvard, only about 1 to 10% of actual adverse events get picked up historically by VAERS with them. With vaccine rollouts, and there's more deaths reported to VAERS right now from this vaccine than all other vaccines combined in the past 30 years. So my written testimony, though, I'd like to point out that something that hasn't come up yet, which is Pfizer has been found criminally liable by the Justice Department at least 4 times in probably the past 15 or 20 years, the most recent of which was they were fined $2.3 billion for giving lavish gifts and kickbacks to their best pill pushers. Right, so this is the company that then provides the data to the FDA, their results of their test from about 2,500 kids that were studied in this age group, of which a good portion of them were probably given placebos. The FDA then went on to give emergency use authorization, I understand, on that. And what they did ultimately with the approval of the community was they have claimed that they're both the same chemically, right? But they are not distributing that right now. We're using the BioNTech label that is under the EUA. And that, as has been stated, limits them from any financial liability should anything come out of it. If they could just swap the label and do community, opening them up to potential liability, why haven't they done that? Right. To quote one of the FDA advisory boards last night on the vote, when they voted 17-0 to recommend the EUA for young children, he said, "We are never going to learn how safe this vaccine is unless we start giving it," quote. Right. So Pfizer gives them the results. Ultimately, the FDA performs or approves based on the science that they may or may not have baked ultimately. And I do have reason to question, their ethics because of this, their past behavior. So we are mandating that children take part in an experiment with no long-term safety data whatsoever on the effect for those children, right? And so ultimately, you're going to force parents. So you talk about carrots, but ultimately the stick here is at the end of a gun, you're going to make them get a vaccine that theoretically, according to Pfizer's own website, this disease is less dangerous to them than the flu. The Nuremberg trials have been mentioned here a lot in the Nuremberg Code. I doubt it's enforceable in the United States, but it does give some reference for ethics here. Some of the things I'd like to paraphrase to point out that came after the experiments that were done on a lot of children and adults is that voluntary consent is essential, and they should have the legal capacity to consent, which minors do not. Force, duress, coercion should never be used, such as banning them from school or firing your employees, quite frankly, for not getting it. The individual should be made aware of all potential side effects that they could get. On Pfizer's website, they list severe allergic reaction, myocarditis, which is inflammation of the heart, pericarditis, which is inflammation of the lining around the heart. And as many of you may know, damage to the heart as a young person can have a lot more severe consequences than someone who's older when their heart is developed. And that could lead to a severe reduction in life expectancy, or maybe they could never play sports, who knows? This experiment, according to the Nuremberg Code, should be based on animal experimentation, which the Trump administration skipped, and they went straight to human trials. So we are currently in a human trial of this vaccine. The risk of the experiment should never exceed the problem to be solved. And as stated by Pfizer on their website, on their press release, COVID is less risk to the children than the flu. And so injecting experimental drugs with unknown long-term consequences of the children merely to protect adults, if that's the goal, is by definition unethical. So as it stands, this bill would make it so that all students, private, public, charter, are being coerced into doing this if they don't want to. And that could be based on things that were done to the African-American community by our own government, right? And other issues with Native Americans as well. And I assume the people with the means and sense to protect their children that don't want them to be lab rats will leave DC and take their tax dollars with them. So I'm a long-term DC resident. As for me and mine, if this passes, I will leave and I will never contribute to y'all's salaries again via my tax dollars. So I propose you amend the bill and make it so that DC, since Pfizer, Moderna, and Johnson & Johnson are conveniently off the hook, that DC and anybody voting in favor of this bill is financially on the hook for any of those damages. Common thing when you go around to DC protests related to abortion is my body, my choice. So I'd like to know what happened to that. And in instance of my children, the choice is mine, not yours. I'm happy to take any questions. If anybody would like more information on the VAERS data, it's clearly published on there, but ultimately, this is something I believe we are rushing headlong like lemmings here. We do not know how this will affect children. And ultimately, if you want to do it to your child, by all means, but that is not coming anywhere near my child, and I have the means, I will leave. And a lot of other taxpayers will probably do it. And many of them who were vaccinated. My mother, for instance, has encephalitis. According to according to Johns Hopkins, she now can't feel her fingers. She can barely walk. She's got neuropathies on her feet with no known treatment to be able to fix it. She went from being an active person chasing around her grandkids to now she can't pick them up and she falls down the stairs. So to act like there aren't any negative effects, I'm sorry, there are. There are people who have been injured by this, and we should allow parents the option, because otherwise, to Chairman Mendelson's point, how are these kids going to go to school if they don't want to get in here and they don't want to volunteer? Yep.
You're about 3 minutes, almost 3 minutes over your time.
Sorry about that.
Thank you for your testimony. I believe that's all of the witnesses in this group. We'll have a 5-minute round of questions from council members. I did have a question for Ms. Smith, Kelly Smith. I just wanted to be clear here. And I think your testimony was similar as that from some other public charter schools. It's not that you're testifying against a mandate. It's that we need to be thoughtful about how that mandate is enforced in terms of any burden put on schools, and also in terms of kids who may be, as written, precluded from attending school. Am I understanding you correctly?
Yes. As a parent, as a school, we do not oppose the mandate, but we need more time to prepare our families for it, to deliver the actual administration of the vaccine, and to create a system that we can actually track. Right now, the current disassociated school records and health records system does not allow us to effectively track even our previously required vaccinations. So I'm an advocate for investing a lot in the way that we partner with the Department of Human Services, Department of Health, to really be able to pull off creating safer school environments.
All right, thank you. That's helpful. And it's certainly something that we will be looking at with regard to this legislation moving forward. I hesitate getting into this, but I feel that there's some responsibility as a public official. So I want to say this. We're dealing with a public health pandemic. And a public health pandemic is a little bit different than just simply the course of a disease or an illness. And we can debate with regard to the course of a disease or illness, whether government should step in, for instance, smoking and lung cancer. But with a public health pandemic, we're looking at such factors as, if the incidence of the disease becomes great enough that our hospitals are overwhelmed, we will see increasing number of deaths. We will also see a lack of capacity in our hospitals to treat those who are sick from the pandemic and those who need hospitalization for some other reason. And in fact, if you go to coronavirus.dc.gov, you will see metrics under data, under reopening metrics that track what our hospital capacity is, among other things. And when we look at the public health, we are looking at a balancing between an individual's health and what is best for the community. So those are the issues. Nobody is saying that this vaccine or any vaccine is 100% safe for 100% of the people 100% of the time. And so we look at public health experts, whom I recognize some people distrust, but like Centers for Disease Control or Food and Drug Administration, or even the American Academy of Pediatricians, to see what they think in terms of the balancing of whether it's better for the community, even though there may be some risk to individuals. So there was one person who testified about 15,000 people dying. It was kind of interesting how it was written, because it said 15,000 people dying after getting the dose, not saying that there was a causal effect. Turns out that there actually was something done that spoke of 150,000 people. And Ms. Raskin, you did submit this. It's a Reuters fact check. Now, it's possible that people could think that mainstream media like Reuters is not reliable, but there's a Reuters fact check dated October 4th, 2021. And it speaks to this issue of 150,000 people. It notes that there says there were 8,164 reports of death. That's 0.0021% among those who were vaccinated. It does not say that there was a causal relation to the vaccine. And in fact, it's not clear. I'm looking at another statement here. There is, however, a plausible causal relationship between Johnson & Johnson and blood clots with low platelets, 3 deaths. Rather than go into this in more detail, if folks are interested, Google the Reuters fact check on VAERS, V-A-E-R-S data. Does not suggest COVID-19 vaccines killed 150,000 people. I'll say a little bit more. The number 150,000 comes from an extrapolation, maybe a calculation done, estimating an underreporting rate of adverse reactions. I'll leave it at that.
Chairman Mendelson, I believe that's somebody trying to extrapolate from the Harvard study, claiming that there's only about 1 to 10% reported.
People can go to the Reuters fact check and figure it out for themselves. Councilmember
Excuse me. Hi, it was my testimony that it was 15,000. I didn't say 150,000. So I think the Dr. Raskin is incorrect. I was stating the VAERS report, and VAERS reports, I'm sure this is the CDC. This is their, yeah. Okay. Yeah.
So let me turn to my colleagues. Councilmember Henderson, did you have any questions?
I did have a couple. Thank you, Councilmember, not Councilmember. Thank you, Chairman. Ms. Smith and Ms. Rochelle, I don't know if she's still here from LAM. I want to thank you guys so much for testifying today. I can appreciate, I think, the situation that schools are in at this particular moment. I was talking to someone the other day, and I was saying, I feel like in a lot of our conversations and interactions, it has been a lot about testing and protocols and cleaning and filters, and not a lot about what's happening in terms of student learning. Like, is anybody reading? Is anybody, thinking critically in the classrooms? And so I can appreciate the challenge here. But I just want to sort of tease out, are you suggesting that because a vaccine mandate deadline that might come in the middle of the school year, that increases the burden for schools, as opposed to if the mandate came for the beginning of a school year? Does that make sense? So I think someone on the earlier panel suggested that this is different because, with our routine immunizations, it's pretty set already, but also knowing that we're not having to do a workup period. Folks can kind of know, like, okay, school starts in August, I need to do X, Y, or Z.
I'm happy to speak on this, or I'll let someone else. It definitely does, right? We collect all of that information at the same time in the spring and through the summer when we register students for school. The administrative burden of collecting that information isn't even my greatest concern. It's just the actual being able to get our students vaccinated, getting them access to doctors in our school setting without their parents having to take time off work, or providing a provision for them to be able to take time off work. We have given our staff so much access to health experts in order to get to a place of a mandate that I would, out of respect for our families, want to give the same thing once we actually have the information and the eligibility available to them. So there is definitely a greater burden now than if it would be, but it's also because I would be hustling starting yesterday to find doctors who would come and talk to my parents if I can't get a commitment that the Department of Health is going to do that. Because I would never say to them, you can't come to school on December 16th, but I've also given you no education or resources on what this means for your family and your child. But I'm not a health expert. And I think that's a big piece of it for me in the school leverage piece, is that we are acting like health experts nearly every single day. And I have a lot of concerns about us implementing additional policies that will place that burden on schools again, because we're going to be asked the questions from families if there's not another point person.
Right. And I mean, I'm curious, do you get questions from families now on just regular immunizations?
When we say you can't come to school anymore until you've done them, yes, I talk about the HPV vaccine. Luckily, I'm a parent, so I can speak from a parent perspective, right?
Yeah.
We have a school nurse. We're very lucky to have a school nurse most days of the week, so I can refer them to that person as well. I want to be honest, I'm ready to get my kids vaccinated because I'm married to a physician. He works on the front line of COVID care. I have access to information that other people don't. And I don't represent the average parent in my school, and not a single parent in my school community when it comes to the access level they have to healthcare and to information.
Okay. That's helpful. Thank you so much, Ms. Smith. Ms. Jablow and Mr. Goldstein, I appreciate you guys testifying. I know you're kind of doing this double duty in terms of you guys were part of, I think both of you testified yesterday as well. Mr. Bergman, thank you so much for your testimony and for the support from the Ward 3 community in terms of, the work that here we go. Ms. Rochelle is back. Sorry, I asked some questions for Ms. Smith, but I think she kind of covered it in terms of what we're trying to do here. Great. I was hoping that the student would be back on. David, now you're older, you're in high school, correct?
Yes, I'm a sophomore in high school.
Okay, sophomore. So can you talk a little bit, like, what's the conversation like in terms of your classmates? Because right now there is a vaccine mandate in place for student athletes. I don't know, I think your high school has athletics. So was that a controversial move, or was that something that everyone was like, okay, this makes sense?
I have not talked to a lot of people about it. I know Miss Moscoso, she's a parent at Walls. She mentioned earlier that the HSA did a poll and found that pretty much everyone who responded to the poll was vaccinated. So we're a very vaccinated school. That doesn't mean I am fine with that. I want everyone to be vaccinated in every school in DC. I have heard some things that some people are unvaccinated, and that just annoys me a lot. I think that one of the things I heard, someone was unvaccinated, and the mandate for sorry, it's a little loud where I am right now.
I mean, you're in school, so
yeah. People are transitioning to lunch. The mandate for student athletes did convince one person I overheard to get the vaccine. It wasn't, but to answer your question, I don't think it was too controversial. But I don't think our school is a good study, a good case study, as we were already pretty vaccinated.
Okay. Thank you, David. Thank you for taking the time, because I know you're kind of juggling a lot here, and I'm over my time. Thank you, Mr. Chairman. Thank you for everyone testifying.
Thank you, Council Member. Council Member Nadeau.
Thanks, Chairman. I really appreciate this panel. And I did want to ask Ms. Silva-Russo some questions. And I have to admit awkwardly that I'm a lamb parent. But I want to thank her for taking the time to testify today. And just note, Lamb's done a really good job of getting teachers and staff vaccinated. And I wanted to sort of reflect on that and ask you, lessons learned on how that could translate to the school community and how else schools need to be supported if a mandate is in place. Because I know that it's something, Lamb's been very focused on all of this holistically.
Thank you very much. And for this, I think it could be, or it could become a vicious circle, because, for example, right now, and I just want to put it as an example for you guys, right now, I was focusing on this task and I had to just run to cover an emergency here at the school. That has something to do with the lack of personnel, etc. But the thing is, we are dealing with a lot of hats at the same time. And it's exhausting. And I think I'm not the only one saying it. I completely agree that vaccination is one of the, it's the main focus to get out of that area and of that hole or the area that we're right now. But also, if we don't do it correctly, we can damage some kids. Even someone else mentioned it too, even bringing the staff into 98% of vaccination within the school was a challenge. And someone also mentioned, just for the council just to be agree among you, it's difficult. So can you imagine in a school with 500 families, in a school system with I don't know how much students? So it's hard, but you have to hear the voices. And at the end, you have to take the decisions, but also with the parents, it's extremely difficult to be in this, for all of us to be in the same page. We have to take the decision.
So I hear you that it's hard. And so I don't think anybody disagrees. I guess my question to you is, what can we do to make it less hard?
It's just to give like the network support. For example, with the vaccination, I think all of the people that talked here have awesome ideas. The mobile vaccination is a great idea, just to bring the pediatricians on board. We have families telling us that they ask for a appointment with their pediatrician and it's in 3 months. Yeah. So what am I going to do with that parent? I'm going to tell him, okay, you can wait those 3 months. And then when another parent came and said, hey, this parent has 3 months to bring the immunization, why not me? Et cetera, et cetera. So it's just the planning part that I think we need support with, and we have to participate also on that planning.
And how do you feel about the idea of vaccinations being available at the school, if, with the government support?
I can put you the example of testing. We have a little kiosk here that is from a private company, but it's just working so well on all our process of putting student in quarantine. So the parents just can leave the school and go there and do their test. So that's exactly
we did that. Yep. Agreed. So in that case, the school has a private partnership with Curative. But that was something that you had to set up on your own and take the initiative on. And so that taxes you. I mean, that stresses you and other members of the school community. And so what I'm trying to think through is, what can we as a government do to help provide services like that? So how do we get the mobile vans or the clinic or whatever it is set up? Lamb and West are right across the street from each other, right? How do we think strategically about where schools are located and how different school communities can benefit at the same time from particular outreach? So that work still needs to be done, clearly, and that's why we have these hearings. I think it's not a reason to oppose a mandate that's going to help protect our community, but but it is a reason to very carefully think through the details and how we're going to support schools and school administrations.
And if I may just add, people with jobs like mine could be a perfect link between the government efforts and the school efforts to put things together.
I know you didn't just volunteer because you've got too much on your plate, but that's what it sounded like. Thank you so much for your testimony. Thank you, Chairman.
Thank you, Councilmember Nadeau. I don't believe any of the council members are present right now. Pause for a second. So I'm going to thank each of these witnesses, each of you for your time and your testimony. And I think this has been a healthy discussion. I'm going to turn now to the Deputy Mayor for Education, Paul Kine, for the government's, the executive's testimony.
Chairman, would you like me to begin?
Give it a second. I think usually what we do is we dismiss folks from the room. It's apparently happening very slowly. That doesn't mean that folks, the witnesses can't continue to watch and hear the hearing on the Zoom platform. Deputy Mayor Kine, I think it's you.
Well, good afternoon, Chairman Mendelson, council members, staff, members of the community. I am Paul Kine, Deputy Mayor for Education, and thank you for the opportunity to testify before you today on this bill, the Coronavirus Immunization of School Students and Early Childhood Workers Amendment Act of 2021. The Bowser administration has been a strong and steadfast proponent of vaccines as a key mitigation strategy in the fight against COVID-19. The Bowser administration clearly recognizes the importance of immunizing children as well as adults to reduce community spread, illness, and mortality, and to maintain our vital city functions, including in-person learning. The mayor wholeheartedly supports the COVID-19 vaccine, as evidenced by the mayor's orders regarding COVID-19 mandates for government workers under the administrative control of the mayor, school and childcare workers, and student athletes. The mayor has also made significant investments in outreach, education, and incentive campaigns to encourage broad uptake of the vaccine. We are proud that 71% of eligible district residents are vaccinated. We are heartened by Tuesday's U.S. Food and Drug Administration's FDA Vaccine Advisory Board vote to recommend emergency use authorization of the Pfizer vaccine for children ages 5 to 11. And we look forward to next week's Centers for Disease Control and Prevention meeting, where we anticipate an emergency authorization for this age group. We are grateful that these agencies have already given full authorization for children ages 16 and above, and emergency use authorization for children ages 12 to 15. In light of these recent developments, we are exploring the most appropriate timeline for a full-scale youth COVID-19 mandate. This year, we are laser focused on supporting in-person instruction and helping students reintegrate into the classroom academically and socially. While we are supportive of the spirit of this legislation, we have concerns about the timing and implementation of the mandate outlined in this bill. Let me share with you our concerns as we work together to chart a path forward that keeps our children safe and maintains robust in-person learning this school year. First, the vaccine has only been fully authorized for children 16 and above. With emergency use authorization for children 12 to 15, we are eagerly awaiting emergency use authorization for children ages 5 to 11. Once the vaccine is approved for younger students, we want to give time to parents and guardians to learn more about the vaccine, process information, and have important conversations with their children and their children's pediatricians, which is critical for building trust. Through our vaccine work with older children, we have learned the critical importance of a comprehensive rollout plan, which must include outreach, education, communications, connection to trusted health and community partners, and access at locations across all wards of the district. The rollout must also include thoughtful operational protocols for any school-based mandates, including systems to request, review, and process exemption requests, data collection systems, and reasonable enforcement mechanisms. This takes time. We understand from our discussions with families and physicians that vaccinating younger children will be a tough initial decision for many families, and we believe that rushing it could result in undesirable outcomes, as families feeling pressured to meet a new and urgent deadline may decide against it. Secondly, we do not think it would be fair or right to ask our already overburdened schools and LEAs to take on the significant additional burden of processing exemption requests and enforcing the collection of immunization paperwork. Based on our current work with student athletes and school-based staff, we know it takes significant time to develop internal processes to operationalize and execute each component of a mandate and to communicate the details to the school community. This mandate would be particularly burdensome for schools with large student populations, which may receive dozens of religious exemption requests, which require careful review and conversations with families. Our school leaders and their teams are spending a significant portion of the instructional day addressing COVID-19 health and safety protocols as it is, and are just starting to find a rhythm that allows them to focus on the essential functions of school with students, teachers, and staff. Observing classrooms, engaging students, instructional coaching, reviewing and acting on assessment data, and adjusting learning plans to address gaps from the pandemic. Making sure that our operational timeline for a mandate provides school teams with sufficient time and bandwidth for implementation should be a non-negotiable. Thirdly, and critically, we believe this immediate mandate could discourage some families from sending their children to school due to vaccine hesitancy or other more logistical challenges. Wards 7 and 8 have the lowest vaccination rates, with only 24 and 21% of youth ages 12 to 17 and 44 and 37% of adults fully vaccinated in the respective wards. We are particularly concerned that children in these wards would be affected by a mandate that includes exclusion from school as an enforcement mechanism. We cannot afford to have more students out of the classroom, falling further behind. We do not support policies that we think would have such a serious consequence. However, with sufficient time to provide families and students with information about the vaccine, an opportunity to talk to their pediatrician and loved ones, and access to vaccination sites across the city, we will see rates climb and will be in a different place to issue any necessary mandates in the future. For these reasons, we believe that mandating the vaccine by December 15th, 2021 would result in a rushed rollout, create more confusion and pressure on schools, and lead to mixed enforcement at best. We do not believe the merits of a mid-year mandate outweigh the potential downsides and risks. In the meantime, thanks to strong layered systems of safeguards and mitigation efforts, our schools remain safe. We have asymptomatic testing positivity rates of 0.5%. We have had 900 positive cases of students across all our public schools with over 90,000 students in attendance, and we have had no child fatalities in DC. While we do not support a mid-year mandate, we are proactively working to encourage broad uptake in COVID-19 vaccinations among DC's children. This year, DC government has partnered with pediatric clinics, health providers, faith-based organizations, community groups, and schools to ensure all eligible youth and their families have access to a convenient, free COVID-19 vaccine. Since the launch of our youth incentive vaccine program on July 29th, we have almost doubled the number of age-eligible youth who are fully vaccinated, going from 7,200 fully vaccinated to 14,225 as of the 18th of October. We have had youth incentives available at 4 dedicated sites, 2 back-to-school events, and now at combination locations offering adult and youth incentives. More than 1,200 youth have participated in one of these sites, with the highest percentage of students coming from wards 7 and 8. We have paired incentives with strong outreach and communications, including work from the city's COVID-19 ambassadors, a vaccine town hall with Howard University School of Medicine, phone banking for our back to school campaign with Link, countless messages through our school leaders, and a sweepstakes giveaway event at Digital Pioneers Academy, where we awarded our first $25,000 college scholarship to 9th grader Trayvana Lewis earlier this month. As more students become eligible for the vaccine, we plan to continue utilizing the vaccine exchange to give schools the chance to serve as host sites, expand grassroots phone banking outreach to thousands of families, and work in close partnership with our pediatric partners who will be instrumental in getting COVID-19 vaccines into the arms of children ages 5 to 11. We welcome the Council's partnership as we strongly encourage vaccine uptake this year among our city's children and families. We urge the Council not to mandate a vaccine mid-year, but to work with city agencies and community partners to ensure that we continue to increase information and awareness among eligible children and adults so all residents understand the critical individual and community benefit of immunization and get their shots. We are happy to engage with the Council and take your input around the parameters of a vaccine mandate, for example, level of authorization, exemption process, and the timing of the rollout, but urge the Council not to make this mandate now. In terms of the additional components of the bill, we are supportive of the provisions regarding the certification of immunization for childcare workers, which is in keeping with the Mayor's Order 2020-109 and the electronic submission of immunization records, which is in line with the doses data migration work underway. Thank you for your time, and I look forward to answering your questions.
Thank you, Mr. Kine. We'll have 1 or 2 10-minute rounds for questions. So your issue with the bill is that it mandates this as of December 15th. If there was, I think the Children's Law Center said next school year, if that was there, then your opposition would go away.
Right now, Chairman, I think what you're hearing from me is that we are opposed to an immediate and what feels like a rushed mandate to a relatively arbitrary date for all the reasons that I outlined in terms of families and schools,
yes,
and so forth. And
the arbitrary and rushed is the December 15th date that's in the bill.
Correct.
So let me ask you this. I'm going to kind of step back from the bill and ask you more conceptually. How do we require a vaccine if we don't enforce it? And enforce it, the only enforcement mechanism that I know of is to say you can't come to school if you're not vaccinated. How do we require a vaccine if we don't enforce it?
That is the way to require a vaccine, is to have an enforcement mechanism. And you can see that we are in favor of a phased approach, as the mayor has announced, for beginning with student athletes. And the enforcement mechanism there is you can't play on your sports team. So yes, that's the enforcement has to go along with the requirement.
Now, there is a question there, which I'll come back to in a moment if I remember. But let me go to this question. Why would we require a vaccine for this pandemic next year when the pandemic is now? We don't know where the pandemic's going to end up, but we do know that right now there's a whole lot of hesitancy among some parents about sending their kids to school, and some teachers are hesitant. And are we going to see community spread? And the virus has gone down in its incidence, but if you look at the flow chart on the vaccine on coronavirus.dc.gov, it goes up, it goes down, it goes up, it goes down, it's down, it might go up again. What's the point of doing this if it's going to be next year? I'll put it a little differently. So I could move the bill and the bill could say beginning next September 1st. But that means for the next 13 months while we've got this pandemic, while we're in the pandemic, we don't have a requirement. What's the point?
So Chairman, I would respectfully offer that I certainly don't see this as a binary decision where you have a requirement or you do nothing. And I think what's important for us right now is that we have introduced a requirement for all adults in all schools and all childcare centers. So there is a requirement in place there. We're mandating of the vaccine of all of those adults in all these settings. And secondly, we've begun a phased approach to a mandate, which includes student athletes. And very, very importantly, we are putting a lot of energy and effort into increasing access, education, outreach, and encouraging encouraging vaccination amongst school-age children. And you can see lots of evidence of that around the city. And so right now, we believe that's the most appropriate course of action, where we're mandating for adults, we're beginning a phased mandate with our student athletes, and we are doing a lot of work to build confidence amongst families while we are ensuring we have as many students in school as possible. And in some sense, to me, that's the fundamental trade-off of this bill. where you're suggesting that this particular lever, which is a full mandate, is worth putting thousands and thousands of kids out of school, which is an obvious consequence of what would happen if you do this now. And I think what we're suggesting is that's not the right trade-off at this moment in the pandemic.
Let me go back to the question that I was tempted a minute ago, and that is, isn't there some other enforcement mechanism besides telling a kid he can't be in school? Now, I'm not just talking about COVID, I'm talking about the other vaccines. We've required vaccines for a number of years, measles. We don't enforce it, and so what's the point of the mandate? But that's not my question. Isn't there some other way that we could enforce rather than keeping a kid out of school?
Well, we certainly have looked around the country at what some other places are doing, and there are jurisdictions that have some other kinds of enforcement mechanisms, which include you can go to school, but you can't participate in X, Y, or Z activity. But again, that's not the approach that we are currently encouraging as we consider this phased approach to the rollout of the vaccine. So there are clearly things you can do with students that encourage more, which would be excluding from certain school-based activities. I know we've talked about that here before.
I do have some data questions, but I think I'm going to submit those to you in writing. Let me see what other questions I have here. For students over, I guess it's the age of 12, where the vaccine is available now, and I guess it's over 17, that it's not an emergency use authorization. What's the take-up rate for being vaccinated?
So I do know the answer to that question. Let me just pull it for you. So we've had, as I mentioned in my testimony, 14,225 young people are vaccinated. The percentages vary by ward. So Ward 1 is 55%, Ward 2 is 73%, Ward 3 is 67%, Ward 4 is 61%, Ward 5 is 42%, Ward 6 is 46%, and as I shared in my testimony, Ward 7 is 24%, and Ward 8 is 21%.
My understanding is that the vaccinations are not available in the schools. Is that correct?
No, that's not correct. We actually had vaccinations available across 37 of our school sites. In addition, we ran quite a robust vaccine exchange program, which allowed schools to sign up for pop-up clinics, which was quite popular with charter schools and community-based organizations. We had our 4 incentive sites, or 3 incentive sites, which were at DCPS middle schools. So there has been a lot of availability at school locations.
But if my kid goes to, let's say, Plummer Elementary School, he or she can't just go into the nurse's office and get vaccinated.
That's probably correct for a few reasons. One, as we discussed earlier with the panel, there is a requirement for parental consent. And so the child can't just go in to the nurse's office and get vaccinated. Also, we're not offering these vaccines across the nurse health suites in the schools. That's not the approach that we are taking.
Why not?
Because what we have seen in terms of the school-based work is that there is lots of different uptake depending on the school site. We've looked at other jurisdictions, for example, New York City, where we saw them standing up vaccine sites in every middle school and high school and getting an average of 6 students vaccinated. And also just talking with families and other healthcare professionals and understanding that for many families, they actually don't want to walk into a school gymnasium or into a room in a school and get the vaccine. They actually want to do it in an environment that they're familiar with and comfortable with.
The only problem with that is that they're not. I mean, they're not walking into the school nurse's office, but they're also not walking into an environment that they're comfortable with. Not at 21% in Ward 8. I mean, the challenge with increasing utilization is increasing, or maybe I shouldn't say the challenge, the answer with increasing utilization is increasing access. And one of the witnesses testified that while a parent or guardian has to consent, if the student is a juvenile, that consent can be given beforehand. So to use Plummer as an example, and maybe that's unfair, maybe I could just say XYZ school, the principal could send a note out to all the parents, please sign the consent form. And some forms will come back, and then the nurse could do the vaccine. I'm just trying to emphasize that I think that
if I could just offer a quick response, Chairman, to that.
Sure.
Firstly, just to be clear on the youth vaccination rates, I read off the fully vaccinated rates by ward. It is also the case that 78% of our young people are at least partially vaccinated. So the situation is not is not exactly the same as if you look at the fully vaccinated population. And secondly, just to be clear, I am not saying that I don't support, or that the administration doesn't support, DC Health doesn't support broad access. In fact, we've got well over 100 sites around the city to provide access to the vaccine. We have done lots of work in schools. I think the question you were posing is, should we do it in every school? And when we look at resources and capacity and the best use of what we've got in terms of our supply, we actually don't think, based on the work that we've already done, that the best approach is to try to provide this in every single school.
So the 21% in Ward 8 is fully vaccinated.
Correct.
But citywide, partially vaccinated is what percent again?
77.2.
Nonetheless, this is a major barrier, if you will. Let me not say barrier, a major issue with some parents and their reluctance with regard to this non-virtual and mandatory school reopening. And I know you agree that increasing the number of vaccinated kids would make a big difference. I'm over my time, but I will just say this, that I think we're being presented with a quandary. We want everybody to be vaccinated, but don't move this bill that requires that everybody be vaccinated. But there are other steps that we could take with regard to access, but we don't want to take those steps. I don't want to say that the executive isn't doing a lot, but still there are a lot of students who are not vaccinated and a lot of parents who are upset, and that's what we're grappling with. Council Member Henderson, I think you're next.
Thank you, Mr. Chairman. Good afternoon, Deputy Mayor. I had to check to see what time it is. Thank you for being here today. I actually want to start on a part of the bill that isn't necessarily getting a lot of the conversation, which is about the early child care workers piece of this, right? Obviously, I acknowledge and know that the mayor's order, covered child care workers, but one of the reasons that we decided to include it in this bill was because some could argue that the legal standing that the mayor has to have a vaccine mandate for private businesses might be a little bit shaky. And so this kind of gives a little bit of cover here. Do you all feel like that's not necessary, or are you opposed to this piece?
No, I tried to make clear my testimony, Councilmember, thanks for the question, that we're supportive of that part of the bill. And in part because we do think it helps to reinforce the work that we're doing, the essential work. And we're also supportive on the digital access, which is also in line with DC Health's robust effort now to get this sort of DOSIS version 2.0 rolled out to schools, which will allow digital access for immunization records.
Right. I apologize if I'm about to ask you questions that were covered in your testimony. I had to step away ever so briefly. Is the issue around thinking it's too soon? Like, is the deadline the problem? Can we move the deadline? Or is it you just don't feel like we need to go this step at all?
Well, and again, I did share this in my testimony, and I'm happy to sort of amplify a little bit here. the mayor and this administration is very, very supportive of vaccine mandates. And as you've seen from the work that we've done, and as you can see with the student athlete mandate, we are in favor of a phased approach to mandates. So at this point, we're exploring, honestly, as we look at this new authorization by the FDA and CDC, and we look at what we learned from the youth mandate rollout, we're just exploring what the right approach is to mandates across student populations. And as I just shared with the chairman, for us, just to kind of cut to the chase, in my own opinion, for us, it's really about this trade-off between putting thousands and thousands of kids out of school versus having a mandate imposed mid-year at this point. And
Okay.
we don't think that's the right decision to make.
Okay, can I ask this just because I don't have it? Could someone from your staff maybe share your written testimony with me so that I could read what you wrote so I don't have to keep asking questions on different stuff? But one of the things that some of the school leaders who testified earlier today talked about was around the enforcement piece, right? And I know that has been raised to even people even folks who have not testified today. And so let me ask this question because, I think in our COVID calls, which are separate and apart from this, we have been asking this question around routine childhood immunizations. Do you know where we are in terms of compliance today?
Routine with the routine pediatric immunizations?
Yeah, just the regular schmegular.
Yeah, 76%.
76. Okay. So like what, 3 weeks ago, we were at 75. So is this still a data issue of in terms of paper forms versus what's in the system?
I suspect there's some of that, but I would say, given that this actually quite closely parallels and is slightly better than we were pre-pandemic, when we were at about 75%, I think we can say the 76% is fairly accurate.
Okay, so in your knowledge, how long have you been deputy mayor?
3 years.
Okay, in the 3 years that you have been deputy mayor, have we ever told a family that they can't attend school because they don't have shots?
Yes.
Okay. Are we choosing not to enforce that this particular year due to the pandemic?
It is seeing what I would describe honestly as variable enforcement across the system, with some schools and LEAs actually enforcing the mandate, and some schools and LEAs actually giving their families a little more grace, because again, they're prioritizing in-person learning.
Okay, so not necessarily uniform enforcement across the board, but you all are providing LEA discretion in terms of how they want to move on this.
Well, the history here is a little bit complicated because 3 years ago, in partnership with DC Health and OSSI, we made the firm decision that we would follow the law much more clearly and enforce. And so at that time, I worked with the superintendent at OSSI to develop new enforcement regulations and guidance, a new attendance policy. We did broad outreach to LEAs. We ran, town halls, and we made clear we were going to be enforcing in September of 2020. And of course, that was the year of the pandemic, and so we paused all of it. Nobody was in school at that point. And then as this year approached, we reminded LEAs and schools that this was now going to be enforced. And again, we made the decision that there would be some grace allowed schools who were working hard to get their students back in person and families who were struggling to get their doctor's appointments and so on, so that we were not going to exclude people, kind of en masse because of this.
Okay. I hear you, and I too am struggling sort of with this tension, right? Nobody wants kids not to be in schools. We want the in-person learning, but at the same time, I don't want a breakout of a virus that could close down the school when we know we have tools in place that can help mitigate and help stop that from happening. And so, I think we have this tension here. So let me ask you this: how the administration already has the vaccine mandate in place as it pertains to student athletes. The deadline is Monday. Do we anticipate are we going to get calls from parents talking about my kid can't play in the turkey bowl because they weren't vaccinated? Like, or, our team's like season is over because of this mandate. Do you anticipate that? Or are you hearing good feedback from schools on this?
I mean, in general, we're hearing good feedback as we've stood up the rollout of the mandate. We've been working with the DC Sports Association. And so, we anticipate, we all saw the article on the Post on Coolidge, and, in general, we anticipate good compliance with this.
Okay. Okay. For that particular mandate, did we allow for medical or religious exemptions?
Yes.
Have you received any of those requests?
Those are going to the schools. And so I believe the answer is yes, but I don't know the number that we've received across the system.
So who says yes or no on those? Is DC SAA the decider there?
The LEA is the decider.
Okay. Now I'm starting to understand where LEAs are coming from just a little bit, because now we have LEA leaders who are having to make a determination on a religious exemption now. That's a hat that they have to wear.
Yes.
Even though we know how difficult it is for our own DCHR to do that exact same thing. Did we provide any guidance to schools on that?
Yes, we provided templates on the forms and lots of guidance to them. We hosted meetings with LEA leaders to help them understand the guidelines.
Okay. I want to ask a couple of questions about the electronic submission certification piece. One of the things that we've heard from schools is that it's difficult because the systems don't talk to each other. So I'm curious, are you engaged in these conversations with DC Health and Octo so that our immunization database aligns to a place where we can actually implement this?
Yes, I mean, we've been talking with DC Health about this, and we're actually very excited about what they're calling Doses 2.0. We're anticipating the rollout of that. I believe it's in December, or it might be in January, but it's actually in the very near term. So over the winter, there will be this new Doses system that schools will have access to. That will be a great improvement, and that will allow the kind of communication that you're describing, but also the digital, sort of the digitization of this process.
Okay. I'm heading on my time here, but I hesitate about this idea because I look at the vaccination numbers that we have for 12 to 17-year-olds, and we clearly have a divide in this city, right? Ward 3 at 67%, Ward 7 and 8, down in the 20s. And I think we're going to have a similar thing when we do 5 to 11. If it is approved for all students, right? Families in one part of the city are going to race out and do everything in their power possible to get their children vaccinated. We might have some vaccine hesitancy on one side. And then we know that kids from Ward 7 and 8 don't just go to school there. They're now mixing and mingling. And what happens when kids start asking each other about their statuses, right? And I think there's just some potentials there that perhaps a mandate where everybody has to get it solves some issues along those lines. But I'm over my time. Thanks, Mr. Chair.
Thank you. Councilor Nadeau.
Thanks, Chairman. Thank you, Deputy Mayor. I mean, I think we've gotten to most of what I would want to ask, but if you could say more about Doses 2.0 and what that's going to look like.
Yeah, it's sort of as I said, it's the way in which DC Health is now standing up a more digitized process to capture, gather, retain, and share student immunization records in schools and across the healthcare provider community. So pediatricians will be able to, the electronic submissions that pediatricians routinely undertake will be connected to this. Schools can load up the information that they've got digitally, and it just allows for much smoother record keeping, access, and transfer. I think it's very in line with what, I'm sorry, Councilman, I was just gonna say, I think it's very in line with what you envisage in the bill.
Great. ideally then parents don't have to get that paperwork done every year. Or they don't have to get paperwork done. at
Yeah,
all.
it would, my understanding is it would be stored within the system.
Okay. And that would be accessible to all LEAs?
Yes.
Okay, great. I mean, you probably heard some of the testimony today, maybe all of it, but you know, one of the challenges that we're having right now as school has reopened is that the pediatrician's offices are just flooded with sick appointments, more or less. I mean, not just because of kids being sick, but also like kids that maybe wouldn't go to the doctor for what they have, because as a parent, you kind of know what a flu looks like and you know what a cold looks like, but they have to go to get cleared to go back to school. So not that we don't want people to do well visits, but I'm just saying that like the less we have to go in for things that we don't need to go in for, the better. And
Yeah,
I think that
I would
also,
agree.
I think that carries over too to the vaccination plan, right? So really being thoughtful about not forcing parents, not pushing parents to go do the vaccine at their pediatrician's office, because it could be months before you can get an appointment for a vaccine.
Yeah, I agree with you, Councilmember, and I would share that the additional complexity there is you don't want to force parents to have to go to the pediatrician's offices to get vaccinated. But on the other hand, you do know, as we heard from our Children's National Health doctor who was on earlier, that we want to encourage families that want reassurance and understanding of the vaccine to be able to do that with their family pediatrician, if that's what they want.
Sure, for sure. And those conversations I'm sure have been ongoing, right? I mean, I bet you at every kid's well visit in the past year, they've been having those conversations, which is good. You know, our pediatricians are being proactive, our doctors are being proactive. I mean, Children's has stepped up. I was speaking to their reps a couple of weeks ago about how they're ready to go for 5 and up, and really ready to take that on for the city. And we're lucky to have them as a partner. And I think what we heard today from some of the LEAs is not that they don't want the mandate, right? Like they just need the tools to help get it done for their families. So.
That's right. And I would share that, you know, DC Health, as it has been working with us and across the city on the plan for youth and the plan for younger students, sees Children's National as a core partner, and they're doing that together. I mean, this is not something that Children's is off doing by itself. This is all done in a coordinated partnership effort, as we consider, as I was talking about with the chairman, the best ways to promote the vaccine for families, but also to ensure that they have the information that they need. We are developing very, very standardized and robust outreach materials, as we have learned that families often need direct connections to talk about it. And then, of course, standing up these partnerships with healthcare providers and pediatricians. I mean, the other point that we haven't mentioned today, which I think I'd be remiss if I didn't, to make sure that residents fully understand this, is that, of course, the dose is smaller for younger children, which means the vials are different, which means that you actually have a different supply chain necessary. And so it's not that you can go to CVS and get the same vaccine vial that everyone else is taking, but for the younger children, it's smaller.
Although DC Health has assured us that they are ready to go with their order. So hopefully we won't have the same supply chain issues that we had last time. And also that the population of children is much smaller than the population of adults that we've been trying to vaccinate from the outset. You know, the one thing that I did want to press on is the sense of urgency. So we've heard testimony today, and I think it's widely accepted that, you know, the more people that are vaccinated, the better they protect the people who can't be vaccinated yet, right? I'm getting vaccinated not just for me, but for my kids who are too little to get vaccinated. And when the 5 and up are vaccinated, it's a huge opportunity to protect the children 5 and under. And if you have siblings that go to school, you know, parents who are worried that the older kids are bringing something home to the babies, you know, it's, in my mind, the sense of urgency is not only about the kids who are eligible for the vaccine, but also the kids who are ineligible. And We can't do anything about the timelines that the CDC puts forth, or the FDA. We can have control over the timelines that we put out for our mandates. And so in my mind, we don't know, maybe the babies will be approved end of the year, like our doctor from Children's was hopefully suggesting, but we don't know that. And that is one other sense of urgency in my mind, is those of us with kids under 5 don't have an option. And we're really at the mercy of the rest of the population to get vaccinated. And the more we can do as a government to put a value on that as a public health issue and with a mandate, I think the better. And I think it really is urgent. I also think with the technology you're talking about, the more we can take off the plates of the schools. I mean, DCHR for a very long time wasn't telling any of us exactly who was vaccinated, but what percentage of our staff were vaccinated, right, for HIPAA reasons. But they had the information and they could push it out to the different agencies and offices. So if we have a central place that the children's vaccination information is, and we can just say to a school, these are the 15 families you need to follow up with, as opposed to you need to make sure every kid is vaccinated. That might be a way to take the burden off the schools, and the burden of managing all of this administratively is something that we heard a lot about today. So good.
Yeah, Councilmember, I agree with you. And in fact, we did do that this year with all the schools. We actually built a new application that delivered into the LEAs all those students that were behind in their routine pediatric immunization, so they could do that kind of targeted outreach. So I do think that's critical.
Fantastic. Well, I'm late for a meeting. I thank you. Thank you, Chairman. Appreciate you both.
Thank you, Councilmember. So I have a few more questions. And the first is this, I kind of touched on it on the first round. I'm having a hearing here on legislation to mandate a vaccine. More broadly, we're talking about vaccine mandates in schools. And I have to say that if I adjourn the hearing right now, I would walk away and I would not have an answer what the alternative is in terms of enforcement. So 76% of students citywide have all the vaccinations or immunizations that are required of them, which is to say 24% don't. So what do we do with those 24%? Disenroll them? Prevent them from coming to school? I don't have an answer there. And maybe there isn't an answer at the moment, but this is a hearing on vaccine mandates. I think it's a relevant question, and I think there ought to be more than what I have right now, which is really nothing.
Well, I hope you don't have nothing, Chairman. I know that I believe we support the idea that, as is required in law, that you need to get your routine pediatric immunizations. And if you don't, the consequence is exclusion from school. And that, as I shared, was exactly the approach that we were taking and all set to establish in September of 2020 to come into full compliance with that law, which we think is vital. And the pandemic has just complicated that in numerous ways, including, as I mentioned, the trade-off that we're making between vital in-person schooling for the social and academic reasons that we all know so well, as opposed to the school exclusions.
So September of 2022, assuming that the pandemic is behind us, 24% of kids are going to be prevented from coming to school?
Yes.
Okay, so in your testimony at bottom of page 2, through our vaccine work with older children, we have learned the critical importance of a comprehensive rollout plan, which must include outreach, education, communications, connection to trusted health and community partners, and access to at locations across all wards of the district. You were speaking of, I believe, the COVID-19 vaccination, but that could apply as well to all the other vaccines. That would make sense. Is that plan in writing?
Which plan, Chairman?
The one you referred to in bottom of page 2 of your testimony that I just read from.
So we certainly have published the comprehensive rollout plan and access plan for COVID-19 vaccines for children aged 12 to 17, so all the students. And certainly we have published extensively and talked about the plan more broadly, the general plan to make COVID-19 vaccines accessible across the city.
right, so where do I find those plans? I could ask you to provide them, or you could point me to the website.
Well, a lot of that information is published regularly on the coronavirus.dc.gov website. Yes. So you'll find the locations there where we've got the.
No, that's not,
outreach.
locations are not a plan. Locations are a list. Through
Well,
our.
why don't you share with me, Chairman, what you're looking for in terms of your parameters, and I'll be very happy to provide it to you.
Through our vaccine work with older children, we have learned the critical importance of a comprehensive rollout plan. You're saying that you have published one for children, I think you said 15 to 18 or something like that?
So what I'm sharing with you is that, yes, we have described in detail in numerous places how we approach the rollout of our vaccine accessibility and encouragement for the 12 and older student population. Yes.
Okay, I'm not getting this. How about if, before the record closes, could you provide us with the comprehensive rollout plan or a comprehensive rollout plan?
Can you describe for what population? So the answer is yes, Chairman. I'm very happy to provide you with all the work that we've done and the plans that we have. And we should just be clear whether you want that for all residents in the city who are eligible, if you're interested in that for the older students, or if you're interested in that for the 5 to 11-year-old. So we'll be happy to provide what.
Why don't we try ages 5 to 18? That would be our students. And why don't we try for COVID-19 and also try for the 24% of students who do not have their immunizations?
Very good.
Is 2 weeks enough time?
Yes.
Okay. Where does the executive sit on whether this mandate should be only for those vaccinations that are fully approved, or versus the emergency use authorization?
So we're very comfortable with clinical trials and authorization that has taken place to date. And I think you'll have seen through our implementation of the student athlete mandate for those who are 12 and up, that we are comfortable with mandates on emergency or full authorization.
Does the executive support this mandate applying now to adult ed students?
We chose actually not to include adult ed students in the current mandate that we have for adults working in schools. So I think there's no.
Why did you exclude the adult?
Because these are, we felt that they were students that fell into a different category from the staff that we were aiming to start the rollout with. And we had conversations with the adult education providers, and we just believed that this was not in the best interest of the school communities that they were serving. In other words, we're not imposing a mandate on students generally, and we saw no reason to impose the mandate on adult students. And in many instances, these students have more barriers to attendance. And so we didn't want to impose an additional barrier there. In other words, we thought of them, Chairman, as students, not as staff, because they are indeed students.
I got you. Although one could argue that the coronavirus is a more serious illness among adults, and adult ed would be adults as opposed to children. Just saying, I think, unless I'm wrong, disabuse me of this, I think of adult students as being comparable to the adult population and different than the student that is age 5 to 18 population.
Yes, that's a different way of looking at it.
The one of the witnesses earlier, I'm guessing Shannon Hodge, said characterize the government's approach to putting a burden on schools for a public health issue, a public health response, burden on the schools to verify, et cetera. Why not recognize that this is a public health issue? In other words, it's more appropriate that the burden is on the Department of Health. It seems to me that this is, practically speaking, a cost shifting issue, that maybe we don't have the money in our budgets, so it's easier to put the burden on the schools. Can't we put the burden on our Department of Health?
I don't know what that would look like exactly. I mean, if you're thinking about needing to have Department of Health personnel staffed in every school to do this. So
keep the records and
I'm not sure. I'm not sure what that would look like. I mean, right now, we do think of schools and LEAs as the locations of a number of administrative duties that relate to school students. And so it feels appropriate that we would have, for example, they gather the documents from families that they know best on routine pediatric immunizations. They ensure compliance with that, which seems very appropriate. And so I think in terms of the vaccine compliance as well, that would be an appropriate place for it.
Well, I do get that. But the, issues like attendance are very definitely school related. Issues like vaccinations are public health related. And we're looking at this from a public health perspective, all of the vaccinations.
Yeah, and that's exactly why DC Health has been expending so much time and energy ensuring broad access to the vaccine for students as well as the general population. And I mentioned some of those.
What I would envision is, rather than my daughter's principal having to figure out whether my daughter's got a vaccine card and whether she's had her vaccines, or my daughter's principal figuring out whether the religious exemption is proper, that my daughter's school principal would simply call Department of Health and say, hey, is Mendelson's daughter vaccinated? And getting an answer from DOH.
Well, one of the things that will happen with the new digitalization of the records is that if the child has been vaccinated or immunized, the school will have access to those records. So nobody has to call anybody.
Okay, I'm over my time, but let me just say, because I don't have any more questions, that I'm feeling like the government isn't doing enough with regard to expanded access. I get that there is a lot of access, but expanded access so that we can overcome these low vaccination rates in the lower income wards. And you will get back with regard to a comprehensive rollout plan for students ages 5 to 18 and also for all non-COVID immunizations. And I also am still walking away from here scratching my head what we're going to do with the 24% of students who are not fully vaccinated. Because while I believe they should be fully vaccinated, I'd like a better answer than, well, on September 1st next year, we're just going to keep them all out of school. Councilmember Henderson, do you have any more questions?
I did have a quick question, or a quick couple of questions. Deputy Mayor, one of the things that I've sort of been thinking about after reading a little bit of what happened at the FDA meeting yesterday was around how some jurisdictions who have moved forward with a vaccine mandate have chosen to bifurcate. So instead of doing all students, they will say, students who are 12 to 17, you've had longer, and so you go first, or high school students must by this time, middle school students by this time, elementary school students by this time. Is that something that the administration would be open to, as opposed to setting a one deadline, but having it bifurcated, so that at least we're providing some, I would say, protections around school communities where our students are transferring classes, right? Or not always in cohorts and pods.
Yeah, I would say that I think, and again, just under the example of the student athletes, you can see that the administration and the mayor are very interested in a kind of phased approach and thinking about different populations differently based on a whole range of factors, including all these different scientific and logistical considerations. So we are certainly exploring, and DC Health is absolutely exploring, if there were to be a mandate in schools, what that could look like and how it might best be rolled out. Yes.
Okay. I'm feeling similarly like the chairman in terms of the uneasiness that such a high percentage of the students have not yet gotten their routine immunizations. And so I'll just say as a PSA for all of those families who are listening, what we don't want to happen is have another public health crisis on top of what we're already been dealing with over the last 18 months, right? A measles outbreak, for example, we don't want that to happen. And so getting your child vaccinated is incredibly important. COVID has obviously taken up a big portion of our conversation just in general in terms of the public space, but these other routine immunizations are super important for us to maintain herd immunity against some of these other diseases and viruses that are easily preventable if everyone just got vaccinated on that front. Deputy Mayor, as we're thinking about going forward, and I'm just curious, and maybe this isn't necessarily a question for you, it's more of a question for DC Health, and you tell me if that is the case. When I look at the data in terms of like the racial disparity piece, so we've done incentives. I would say we've sent people door to door. I have friends in certain parts of the city who've had somebody knock on their door like 2-3 times at this point, specifically to talk about COVID and the importance of vaccine. Our physicians across the city are certainly pumping it at every time they have an opportunity to interact with a patient. What's up here in trying to close the gap? What do we do next to try to get people to take this more seriously? I mean, when we think about 49 of the 50 people who have died in the city since June have been Black. What's our next options here?
Yeah, I'm gonna demur a little bit on that question and say that is exactly the challenge that DC Health works on and has been confronting. I will share with you that in terms of getting ready to stand up for the younger population, again, based on what we feel like we learned, it does go back to some of the things I've already shared, which is that people really do want to get vaccinations in environments that feel familiar. It does require the building of trust and feeling as though you're getting trusted information from trusted sources. And so, we learned that the incentives are effective, but they only go so far when you then encounter people who are uncertain about how to proceed, because there are many vaccine hesitant folks across the city. So that's all the work that I think we're doing, and I will demur to DC Health, and I'm happy to help facilitate a discussion on the specifics around that.
Okay. All right, I don't have any other questions. Thank you, Mr. Chairman, for first of all holding this hearing so quickly after its introduction. I appreciate all the witnesses who testified today. I think we had a really good conversation around this issue. So thank you.
Thank you, Councilmember. So I'm going to wrap up this hearing. Again, this has been a hearing on Bill 24-423, and the record will be open for 2 weeks. That is, it will close at 5 p.m. on Wednesday, November 10th. Deputy Mayor Kine, you have one follow-up, which is the plan, and I won't restate it, but it was 2 parts: students 5 through 18, and the second part was the existing immunization requirements. I do want to note before I adjourn that the Committee of the Whole will be having a hearing. It's a roundtable on the Jackson Reed High School naming on November 4th. On 2 bills, I don't have the bill numbers, but one of them is digital equity for DCPS, and the other is the Common Reporting Financial Standards on November 5th. We'll be having a hearing on November 9th on school security and the OSCE superintendent confirmation, the mayor's nomination on November 12th. The other hearing in November is November 23rd on Bill 24-443 concerning school librarians. With that, thank you, Deputy Mayor Kine, and all of the witnesses who took the time to testify. The time is 2:00 p.m. and this hearing is adjourned.